minutes still.
If you would.
Yeah, but not always.
Hey, good morning, everyone. Thanks for getting here.
Do a quick sound check. Want to see if online participants are able to hear us. If you are able to, turn your camera on and give us a thumbs up.
Just
Or a reaction thumbs
Or
up.
reaction.
It's early. I don't know if you.
Okay. Got a thumbs up.
We
Thank you.
got one person. Thank you.
Thank you, Kenya. Yay.
So
Haley.
welcome everybody to the Virginia Climate and Health Education Collaborative Education Summit of 2025. We're going to be starting off our formal programming. Our co-chair Tremblay is going to introduce the collaborative in just a bit. But before we get started, for those that are on site, appreciate you being here. And from housekeeping purposes, if you need to get on Wi-Fi, I think there are some directions outside, but it seems like it's just a Mason Wi-Fi, and if you can kind of get in, or at least I was able to without doing any login. But if there's any issues about that, then let us know. Hopefully you were able to find parking and park here legally this morning. I think there was a rig that was blocking the entrance to the parking lot, and we all had to maneuver around. But we do have some build-in time for breaks. So any of you guys that have paid in meter or a digital meter per se that needs to move their car, we should have some built-in time in between. But feel free to, of course, do what needs to be done. Food and drink are here, and we will have lunch as well during our noon feature speakers. I think we do take into account of food preferences, allergies, and things like that, and have a sustainable feature in mind when it comes to food choices. But really excited to have you guys here. This might be our greatest showing yet of all the years. But with that, I'm going to turn over to my co-chair Beth to talk a little bit about a collaborative.
Yeah, thank you. So some of you have been around for a year or two, or perhaps more within the Virginia Climate, Virginia Clinicians for Climate Action. And so this particular collaborative really focuses on education of all people who are coming into that healthcare field. So it was established in 2021. With that aim of introducing climate education into curriculum in a meaningful way, that students have tools, leave with tools to be able, they feel prepared to care for people who are inevitably going to have some sort of climate related either disease or something that is worsened by the current climate. So we include all health allied students and faculty and professionals and clinicians, doctors and pharmacists. I think of it, the thing that I really love about this collaborative is that it is such a shared space, and it is a space where we get to talk about how we approach the problems, what we are seeing, and hopefully all of us leave a little inspired, as well as have a bit of information and ideas of how we can inspire our future healthcare workers to really feel prepared for what's next. So I'm going to go ahead and take this over to our committee. I'll just reintroduce myself. I'm Beth Tremblay. I'm an assistant professor of nursing. I've been in nursing for maybe 30 years, about 30 years, in a lot of different areas. And where I've landed is really in community and public health, because that is where all health is created or destroyed, right in our communities. And so it is the air we breathe, the water we drink, our access to things that are really basic to human nature, like trees, right? So these things that we don't always think about as being connected to health are really fundamental to health. So that's kind of my perspective and where I come from. And I have these awesome co-chairs who've been kind enough to be so receptive and bring me into the fold. So I'm gonna turn it back over to Holman and Nick. If you want to introduce yourself.
Well, I'll go first. So Homan Y here. I'm a adult internal medicine physician at Inova Fairfax. Been practicing, for the last 16 years out of residency, and was one of the founding members of VCCA. Really excited to be here, and I co-chair this education committee, given the intersection about climate change and health, and also my passion in education. And it's really inspiring us year after year to see our learners and faculty really look into this issue and want to do something about educating future physicians and clinicians, so that we can help our patients. I'm going to turn it over to Nick.
And I'm Nick Snow. I'm a former gastroenterologist who now teaches at Shenandoah University. I've been interested in the environment since the river that I grew up next to, the Cuyahoga River, caught fire in about 1969, and just sort of transitioned into this over the last 15 years, and joined this group shortly after it founded. You'll get to hear from more people. So this is all important to me, and I'm glad you're all here.
All right. Well, I do want to highlight the participation of this particular summit. We have folks coming from various institutions and backgrounds, and really glad to be engaging everyone from the state of Virginia and surrounding areas in DC and Maryland. We always say that everybody takes care of patients from Virginia. So I think this, even though our organization is named Virginia Clinicians for Climate Action, we're really serving the same purposes and really serving patients of the Commonwealth. We have various students and faculties here, and folks with different titles, but really this is a collaborative where a lot of it is driven by learners. This is one of the subjects where it was brand new to me after I have done all my training, and as a practicing physician, we're trying to catch up on learning everything about environmental health and the impacts on human health. And a lot of our learners are already coming in with that knowledge, whether it's from their undergraduate training or during medical school. And one of our purposes, of course, is to really introduce some of this curriculum in all the health professional schools. So here's our agenda. We're have breakfast and introduction, and then we're going to be introducing our featured speaker this morning. Dr. Samantha Ahdoot will be followed by school updates with various members of the different programs, talking about what they have done in each of their health programs. And we'll do this in two separate sections, so we'll have a little bit of break in between. And then we will have lunch with our featured speaker, Dr. John Balbus. And then we did build in some networking opportunities and hours. Virginia Clinicians, VCCA, we do have our board meeting this afternoon, and many of the board members may come a little bit earlier so that they are also going to be joining in and just saying hi to everybody before we start our board meeting for this afternoon. So with that, I do want to introduce our first featured speaker. And I really shouldn't need to pull up any notes, but because I've introduced Dr. Samantha Ahdoot so many times, and many folks in the room know her very well. But Dr. Ahdoot, she really has been the founder of VCCA. This is her vision. Back in 2017 was when a few of us met together in one of the conference rooms at Innova Fairfax Hospital to talk about our common interest in climate, environmental health, and really seeing some of the impacts that it has on our patients. It was really under her vision that we started this organization. And I always joke that I've always mentioned that, hey, I might just want to be peripherally involved because of the different things that I have on my plate. And of course, Sam has always been able to pull me in to kind of affect changes in the different capacities under her vision. So she was already established in this field when we started the organization. She was the first author of the American Academy of Pediatrician position paper in 2015 and has subsequently been very influential with AAP. She has been, and it wouldn't do me justice to name the awards that she has received and the recognition that she has received in this space. But we're really fortunate to have her come and talk to us today. So she and I actually co-direct a climate change and health elective under UVA School of Medicine, where we're both faculty with, and really have been working with young medical students that are about to graduate to share with them some of the knowledge that we have, but more so the opportunities that we have to engage our patients and also our policymakers. And one of the important things these days is that, in this political climate, we do need a little bit more tools in terms of how to engage subject on climate change and health in such a way that is effective. And with that, why don't I have Sam come up and I'm going to launch into her slide and we're going to have that get that started.
Well, thank you, Homan, and it's really wonderful to see VCCA under its growing membership and great upcoming leaders, and it's exciting to see how the organization continues to thrive with the across the state. So thank you all for being here. And so I'll be talking today about a topic that's on my mind a lot recently, and I suspect you all are thinking about as well. And it's going to be my own perspective and how I'm thinking about it these days. I'm thinking about compassion as the clinician superpower in climate change communication in these divisive times, and how, in fact, our compassion is really drives how we speak with our patients every day and how we talk with people in an exam room. And in fact, how we talk in exam rooms is how we could perhaps bring that type of language to our climate change communications to hope to bridge the chasm in these conversations.
Do you allow me to?
Would I just like that?
Yeah.
And I just, okay, you're good. Thank you. So as I said, it is already the foundation of exam room. In my office in Alexandria, I am working with patients across every spectrum every day. Patients of every political ideology, of every socioeconomic class, and we learn to adjust how we communicate with people according to who we're speaking with, and adjusting our language, adjusting our approach. And I think this is a skill that we can use in climate change communication as well. And it's really unique to us. It's founded and based on our compassion for each patient that we work with in our exam room to improve their health. And we need to do this because climate change affects everyone, right? It doesn't care if you're Republican, Democrat, urban, rural, rich, poor, young, old, or every race and ethnicity. And so if we're not reaching every one of these people, then we're really doing a disservice. We're not helping them. Climate change, they may not care about climate change, right? But climate change cares about them. And so we have to, as our clinicians, it's part of our duty to reach everyone so we can help them. And I'd say at this point in time, we're effectively reaching, and I'm not a communication say, I'm kind of glad Ed's not here listening to me today because this is not my field of expertise. But I feel at this point, we're primarily reaching a smaller group of people who generally already agree with us, generally Democrats, urban and well-educated people. And in fact, we know that the Democrats generally are already well on board with that global warming is happening. This is from the research, the report here, George Mason Center for Climate Change Communication and the Yale Program on Climate Change Communication. And 93% of Democrats, pretty much at all ages, already agree that global warming is happening. 90 to 93% worry about climate change. But it's quite different amongst Republicans. 57% of younger Republicans, 18 to 34, believe climate change is happening. Only 43% older than 55 believe that, and less worry about it. 35% of young Republicans and 28% of older Republicans. So there's a real need and opportunity for us to do what we can as clinicians to help people understand how climate change is affecting them. And I'm going to be speaking today about a report actually generated for candidates, for Democratic candidates, how to communicate in rural districts. And I think that the strategies that are laid out in this report are very valuable for us as clinicians as well. And this report, called Talk Like a Neighbor by this organization, Rural Urban Bridge Initiative, talks about this chasm that we are already speaking to the early adopters and the innovators. They're with us as it says, wow, this makes total sense. What a game changer. I love this. And then there's the majority, which is 80% of the population, right? And we're already, as we said, reaching the people on the left side of that, and about half of 43%, less than half of Republicans. But we have this other part of the late majority, which is a real opportunity and need for us to reach, so that they also understand how climate change is affecting them and the health of their families and what they can do to stay safe and healthy. So this report lays out several strategies to help cross this chasm. And when I read these strategies, I think this is what I already do every day in the exam room. These strategies laid out for candidates are in fact what clinicians already are expert at. And the first four straight from this report. One is using concrete everyday language, not academic or activist jargon or acronyms. And this is what we do every day. Nobody uses this language when we're talking with patients in a room, right? Second is not to lecture, rant, or act superior. And again, this comes very, I think, naturally to us as clinicians. We don't lecture our patients, and we know it's not effective. And it tends to in fact, drive people away. Avoid formulaic political speak. I'm also going to talk about scientific speak here. Stay out of the policy weeds, which I think has extra value for us as clinicians, because generally speaking, people want to know not so much, they want us to bring our unique perspective about how the policy affects health, and I'll talk about that. And then something that I've added, which I think is increasingly important, is avoid other political issues. And I think that when we engage, when we conflate climate change with other political issues, I would say we are playing by the Koch brothers handbook. We are reinforcing the idea that climate change is a progressive issue and is a liberal cause when we conflate it with other issues which are almost uniformly progressive issues, many of which we care deeply about. But by conflating the two, we keep climate change within the progressive realm of ideas. So the first is use concrete everyday language, not academic or activist jargon. And this list of words is from Rural Urban Bridge. And I think these words are part of jargon that resonates with some people, generally on the left. But for others, they can feel, for people that are not on the progressive, or not liberal Democrats, generally they can be viewed as insular or elitist. And again, this narrative that climate change is a progressive issue. And I show this image of a fisherman here because we in fact need to be able to communicate with people of in all fields of all socioeconomics and political spectrum, including, for example, people who work on the water, to help them understand why warmer temperatures can increase, bacterial concentrations and increase risk of infections, waterborne infections. But when we speak with people of those communities, we wouldn't use these words, right, which don't resonate with that population. So adjusting our language to resonate for the broader spectrum of the broader political spectrum. That lecture render ad superior, and I think we have to be aware of some of the terms which may be felt perceived that way. For example, anti-science, climate denier, right-wing extremist, and we need to this type of picture creates a divisive narrative and will alienate certain sections of the population. So we have to be mindful. Even, and that can be difficult, right? When I read some things by the CO2 Coalition, or it's hard not to feel that it's science is certainly being attacked on many fronts, and it's very challenging. But in our communications, I don't think it's effective to use accusatory language or use these sort of dogmatic phrases which alienate people. So doing the best to avoid that type of language. And the positive side of this is finding the common ground and the shared experiences, because in fact, they're always there, when we look for them. Because everyone is being affected by climate change, there's always some shared experience. And I really like the way you said today, Beth, about just trees, and it's part of what it seems so basic, but in fact we all know it's true. It's part of the human experience. There's always common ground that we can find. It's a formulaic politic speak, and I would also say scientific speak. And some of these phrases, when you're working in this area a lot, they become second nature. We know what they mean, but most people do not. And some of these phrases like that, we use a lot, decarbonization, even mitigation versus adaptation. A lot of people don't understand what they mean, the differences between them. Certainly anthropogenic. Emissions, I think whenever we can use a simpler word, it's always better. So everyone knows what pollution is, but not everyone knows what emissions exactly means. So always choosing a simpler word so that everyone can understand. And this is because it helps people understand what it means for their health. If people don't understand the language we're using, they won't understand our message. Now, this isn't necessarily true, when you're in scientific papers and depending on your audience, but for the general public, the simpler words we can use, the better. Stay out of the policy weeds. And for this, I see this as what is our role as health professionals in this? And it's really to translate what policy means for the health of our patients and communicate it in that way. So, for example, this is a bill that passed in Virginia's General Assembly this past year, and it's a development of a heat standard for all school systems across the state. And what does this mean for us? And I speak to patients. Just a couple months ago in August talked to a well-paid patient of mine in my office. And what this means is summers are getting hotter. It's more important than ever that we protect our athletes from the heat. So this is what matters to our patients. This is what matters in our exam rooms, is our perspective on health effects of these policies. And then not to merge with other issues. I think it's critical that we agree to disagree on many other issues, and that the unlikely partnerships are some of the most effective. And this is really hard because this is even issues that we care deeply about, right? But if we have to all agree on everything, then we will never really be able to advance change on a meaningful basis. And I have a picture here from Ducks Unlimited. Does anybody know what Ducks Unlimited is? No. So Ducks Unlimited is an organization that's really developed alongside the Nature Conservancy over decades. As long as there's been land conservation in the United States, basically, there's been Ducks Unlimited. And they protect land. They're one of the biggest land conservancies in the country. But the reason they protect land is because it's for hunting, right? And if you go to Ducks Unlimited website, the first thing you see actually is an ad that pops right up from duckguns.com on buying a program to buy a gun because they're for hunters. And so it's hard. I mean, I'm a big animal welfare person. I'm interested in land conservancy, and I frankly don't like hunting and killing animals. I'm a vegetarian. But I really recognize the value of Ducks Unlimited and the work they do for conservation. And I think the conservation movement has become inclusive because it's effective. You know, Ducks Unlimited has protected millions of acres. And so even though we don't necessarily support hunting animals for recreation, and some people do, you know, that's okay. But understand the importance of hunting in many communities. But being inclusive and agreeing to disagree on some things will make us makes us much more effective in land conservation. And so I think we can bring that also to climate change, agreeing to disagree on other issues, and so that we can together advance climate solutions. And I think this is very hard because some of these things are things we care passionately about. We can't agree to disagree. I'm afraid we're gonna struggle to build a wider net for climate solutions. So in summary, climate change matters to the health of everyone. And to protect everyone, we need to be able to speak to everyone. And as clinician skills help protect everyone. So using our unique clinician skills based on compassion, I think can help us to cross the chasm in climate change communication. That's all I have to say. Does anybody have any questions for me? Yes.
I can get started. So some of, a lot of this is based on trust.
Yeah.
And I feel like in the world these days, I think CAMs are increasingly entrenched in their position. So I'm wondering a little bit more about how we can look at the bigger picture and try to create a little bit more trust between the tribes and parties.
Thank you. So I think I think about some interactions I've had recently in my office around vaccinations. And families who come to me who are already pretty do not want to vaccinate their children, and it's happening more and more. And I think there's a lot of parallels here because generating families, I think involves recognizing the basis for their fears, recognizing why they're concerned, and validating their concerns, because there's a tremendous amount of information right there today, which is very confusing for families, causing families to be scared and uncertain about what's best. So recognizing those concerns, and not dismissing them. And I think just by doing that, you automatically set a different tone, right? I think when I started, and which seems to come first, is maybe saying, you're anti-science, you might feel this family, you're wrong, you don't believe in science, you're just politically, this is a political issue, but bringing the human passionate perspective to it, I think changes that and generates trust. And then starting from where they are, right, and discussing, well, this is my perspective and why I believe these are important. Where can we find common ground? What vaccines do you feel would you be ready to do at this time? How can I help? Because I feel this is really important to protect your child. And what can we do in the meantime to help to protect your child that we can agree on? So for example, right now, there's like the RSV vaccine, which is just now becoming available in a couple of weeks. And so I'll talk to the patient about, why I feel very strongly your baby gets the RSV vaccine today, and this is why. And the pertussis vaccine, and going bit by bit, and often we will find common ground and agree on a slower process to protect their child. So I think the trust, like you mentioned, is based on compassion. And meeting the patient where they are, meeting the person where they are, and that's what I would say. Yes.
Kind of along that lines, especially in the clinician-patient relationship era, where purposeful subtlety over time is probably reasonably powerful. And where I go with that is the goal in that would be to have people think on their own, sometimes apart from the encounter with the clinician. In other words, after the fact. And that doesn't work always when people are closed. However, if that's why I said it's repeated, and it's in the relationship provider, clinician, and patient, family. That repeated subtlety may be quite effective. There's times for that, and there's times not for that. But I wonder what your thoughts are on that concept.
Well, I have from everything that goes through my head. Repeated messages, repeated often, simple messages repeated often by a trusted messenger, right?
By a variety of trusted messengers.
What's that?
By a variety of
Trusted messages, yeah. Simple messages repeated often by a variety of trusted messengers. And simple message that I think that encompasses some of what you're saying here. And we're fortunate as pediatricians that we see families very often. So we can often revisit and have these conversations multiple times, and referring them to sources for when they are at home, for where they're going to look for more information. And I always refer my patients to Children's Hospital Philadelphia Vaccine Education Center and say, when you go home, please be mindful about where you're learning about vaccines. There's a lot of information out there which is very confusing. I get confused on these websites. Some of them you're like, what is this paper about? I've never seen that. And then you go in the weed, read all day and still not exactly understand it. It's just so much. So I recognize when you're home, this is where I would direct you to get the most reliable information. Yeah.
Alexis.
Hi, thank you so much for such a great talk. My question is, we talked a lot about talking to our colleagues and the public. How would you frame these conversations when speaking with lawmakers who may represent a population that sides with one side where they disagree with some of the climate change policies, and feel like they might have to be swayed to have a certain stance on these important bills? What would you, any advice on that?
And this happens a lot in Virginia, and it's about finding common ground, and finding shared values and working there. And that's an important place where you adjust your language. There's certain topics, certain words that are not going to resonate with people in rural Virginia, southwestern Virginia, but there are views, and more than you think. And I think we often think that there aren't, but in fact there are. And so, for example, VCCA worked with the Piedmont Environmental Council and actually researchers here at Mason to develop a program that would incentivize legislation that would incentivize solar panels on parking lots in the state. And in fact, when we brought that to rural Virginians, it was very popular because there's a lot of concerns right now in Virginia about industrial scale solar on farms. And there's actually a lot of opposition in rural Virginia. So right there, that's a shared value of protecting rural lands, right? And also and there was other creating cooler parking lots, generating energy. But the protecting rural lands is through that program was a shared value, that was helpful. And in fact, we had a coalition for that group, for that bill. The Virginia Cattlemen's Association supported it. I mean, so this was part of this broad umbrella, by isolating a shared value. other ones, so I would say finding those shared values. Also, athletes is another shared value, I would say. Everybody cares about our young high school, our young athletes. Everybody wants our children to be active outside and to be able to participate in sports safely. And so working through heat protection for our young athletes, I think was another shared value and partly why this bill went through. Yeah, so there's a lot of opportunities when you approach it through that way.
Last question, Dr. O'Connor?
Oh, thank you. So I'm just going to speak because I'm an artist.
Oh, great.
And dean of that, a college of liberal arts, and I come here because of a trees initiative. I'm a PI on. But my question is this: what are your thoughts on intentional collaborations outside of the ILSOL and medical community that involves sociologists, psychologists, and historians as an avenue to build trust and create language? Because I think clinicians get the end story. You get somebody who's already formed before they come to you. And therefore, they are inundated with experiences that may not necessarily enhance your communication and engagement with them.
Mm.
But there are other audiences that reach them before they reach you and help build that trust. So in one of the communities we work with, and as father figure, and uncle of many physicians, we have this conversation with them in training. The patient you see has baggage that you don't even understand. And they manifest clinically in one way or another. And you're trying to look at that. But maybe understanding what comes before. For instance, when you talk about your pediatrician families coming in, if they are historians, cultural, relativist, humanists, have talked to them about the importance of knowing that as a clinician, your first thing is do no harm. So they're coming to you, convinced that you're going to be that last source. But you can't start when they see you to establish that relationship. So I'm wondering, in the training and preparation of clinicians, what your thoughts may be on intentionally involving these ancillary parts of expertise that actually enhance what you do.
I couldn't agree more. I think it's very important. And certainly, we know through history the importance of the arts in social movements, you know, and the role of the visual, the music. It's so important. You know, I totally agree. I noted the National Climate Assessment, which came out, was it last year was the last one, for the first time included art. And I found the art to be some of the most impactful parts of that report. I love it. It's beautiful, and it affects people through a different way. So I think that's increasingly being recognized. In terms of Virginia Clinicians for Climate Action, I think we have discussed over the years, including, for example, an artist on our board, including working on murals. It's become, I think it's a question of capacity and bandwidth more than anything else. Because I think it is a very important avenue and be very impactful. It's just been a question of capacity, I would say. Yeah. But I think that would be a great conversation.
We started an art committee.
Yes.
If we got a type of champion that can take that on. Well, thank you so much, Dr. Ahdoot. All right, so we have a couple minutes of building break. I'm going to go ahead and get back to the slides here. So next up is gonna be our school updates. So the first 4 schools will be talking between 9:15 and 10:30. So you know, I think with that, we can probably come back and start at about 9:16. Just give folks 5 minutes to kind of get some water, bathroom, etc. But in the meantime, there's a code that if you want to check out Virginia Clinicians for Climate Action or VCCA, if you're not on the listserv yet, please take a look and join. Then you'll be able to get our newsletter.
Yeah.
Families, it's so different than me.
You get obsessed and then if you're doing.
And as soon as they come in, I recognize, oh, this person's made a different
To do that.
yeah, has different policies. You know what I mean? But then you try my best.
Okay, so you're not in this.
Successful in other times. But where do we? What are the focus on? You know what I'm saying?
Right, and
What is our?
I was gonna say.
That's where I can see this person. Place where we-
But anyway, I don't.
But there's always all this other stuff that they come in with.
It's a
And
really
you
good
see, oh,
organization and in this area,
whatever,
I
this is,
feel like.
there's this whole thing over there that but I need to go past that.
It's one, like, what me?
Oh.
And then Dr. like, something.
Yeah,
I'm like going to speak to our, it's all residents and students next week. So
You're
yeah, like I'm still in, yeah, each state has a patients. Exactly.
I was just gonna ask one question. Do you guys get any in your lectures?
Did you go touch
How to sort of introduce a subject like this?
It is.
Some paths or preclinical, clinical sort of stuff?
We have one, you do actually. It's like 1 hour.
About 1 hour, they record.
What do you need?
Well, just sort of how you sort of transition to the topic. See to how you could introduce something like she's talking about, how you could introduce climate change into a
So it'll be interesting.
clinical sort of meeting.
Like a student or. Like, maybe I don't know, I guess I just haven't seen that yet.
Yeah, I mean, not,
Like in our PCM, just like just listen to you and then basically like just learning how to navigate more difficult situations, scenarios. Such as like conversations about, yeah, or like, alcohol use disorder, like to navigate that, like like
the vibe.
a lot of resistant or defensive.
So the
So
TC
I
chapter,
was,
yeah,
so I but it was not at all geared towards climate change conversation.
yeah, I think it would be
Wasn't
useful.
here.
Yeah.
Also just, so that's why like I have like.
Home and go.
Yeah, you know.
I think we're gonna get started again. I'll have everybody gather around.
So.
So true.
I think Dr. Not even think about it.
All around there.
So I just about how it's like a lot of students are like.
Yeah.
All right, everybody, welcome back. Let me just make sure that I am on mute. Okay, great. Well, welcome back again. So for this section, we're gonna have the first few school give their updates. I'm gonna bring up Eleanor from VCU School of Medicine. So Eleanor Delsas, she was the first to register for the conference, so we thought that it would be very fitting for her to go first and really just talk about the great work that we've done at the VCU School of Medicine. So I'm actually going to stop share and kind of hand the podium to you as you talk about the work that you guys have done.
It's nice to meet everyone. So I'm Eleanor. I'm an M2 at VCU. I'm originally from Philadelphia area. And I just recently took on my school's chapter of Medical Students for a Sustainable Future. I think like early March. And I'm co-president with one of my friends. We essentially took it on because we both had kind of come from a place of the environment being something of personal interest. In undergrad, I did a peace and justice minor and took like a lot of environmental classes there and just really enjoyed like the fruitful dialogue that can come from that and just the constant like circle of learning, how little we know about these things, how much we can learn from each other, those experiences. And I was very hopeful then coming to VCU and seeing that there was an environmentally focused student group, that I would maybe get kind of like a semblance of that, because I was missing that a lot. And then I was like a little disappointed when I came because the group was handled by two M1s who were or two M2s at the time, who were also very passionate about the environment, but just a little overwhelmed with the course load and not really able to give the organization, I guess, like the time and dedication that they wanted to initially when they kind of took on that role. But unfortunately, like it was kind of more of a like a flat experience, and I think that they really did their best, and like the events, they did a couple of journal clubs and they were still beneficial. But when my friend and I were encouraged to apply for the position, we really wanted to kind of get back to the roots of what the organization is about. And I think sometimes for people who are already so busy in medical school, it's already a big ask to say, okay, come during your lunch now and let's talk about these things that you might not have background in, you might have background in, you might be overwhelmed. You might just feel like stressed about the studying you're not doing in that hour. So we really kind of wanted to bring it back to the focus and like, why are we here? What do we care about? Let's get outside. Let's just kind of get back to our roots, and then from there kind of build this foundation. So that being said, one of the events that we did last spring was I brought everyone to this park that I'd been volunteering at just for the past year. It's in Southside Richmond, which is historically a more Hispanic community, lower income. Typically, there was like kind of like a food desert where there was also no green space. And then 20 years ago, this man, his name's Bob Arkwright, he decided to build this park and basically from nothing, and just created this beautiful space that now serves the whole community in Southside Richmond and a lot of the children there. And it's just amazing what they've done. They have like a community garden, but also a lot of really wonderful programs for children education. One of the program leaders, she's at UVA, she's a professor there, but she focuses on nature therapy. And it's really impressive just how intentional it is and the impact it's made on the community. So I brought a group of students in MS4 SF, but also opened it up to the entire class, and was happy that a couple people that weren't even interested in or in the program kind of came. And that was just a wonderful experience to hear the founder, we call him Mr. Bob. He's like an 82-year-old man and just has like a magical way of speaking where he talks really slow, but you're just like kind of transfixed. And he has like a very wonderful storytelling capability. But getting to see that and get to kind of interact with the kids and talk to them and just kind of see how special the park is to them. And I think that was really impactful for the students in the organization. And they've like come up to me and wanted to do it again this year. So we have that like planned on the horizon. And just recently too, this past Saturday, I organized an event. So I'm in Family Med like society / program at VCU. And I had done research this summer specifically focused on nature therapy, working with Mr. Bob at this park. And the program director of my Family Med program really wanted me to organize a volunteer event too, just for the entire Family Med program. So I hosted that this past Saturday, again at the park. And that was just really wonderful just to see everyone, seeing like just how magical a place this is. And again, kind of getting back to our roots of being out in the earth, seeing the connection that comes from that, seeing how important it is and just meaningful to like have your hands in soil. So that's kind of the direction that we have been taking. I would say that we're still trying to keep it also definitely having like initiative in the school. And so last spring as well, we hosted a lunch lecture with, we amazingly got the CEO of VCU Health, and he's also the vice president of health sciences, so he has like two names. But he is also a transplant surgeon. His name's Dr. Marlon Levy, really big name, I guess, at VCU, who I just kind of haphazardly emailed him and was like, hey, I saw that you worked on this VCU sustainability plan. That was, I think, an initiative last year. And he was like one of the leaders for it. I emailed him and he's happy to come speak. And we were so grateful to have him there. It was very clear that he kind of knew coming into this that he was going to be in kind of a crossfire. But it was really nice to have this opportunity to ask him a lot of our questions as students of like, really, what is VCU health? Like, what are you prioritizing? What are your goals when you're making these major economic decisions, policy decisions? And he was very, very frank with us, which we appreciated as well. And we had a very candid discussion. But he essentially was acknowledged that while they do have this environmental plan in place, they have this one sustainability plan, ultimately when they're in their meetings and when they're in their making these major decisions about huge economic investments or just various things, the environment does get pushed aside. And he said it's kind of a factor of we're already operating at this very slim margin of profit, and it's really hard to argue that we should maybe invest more in these types of materials when we're building this new building, because I know it's hard to see the investment now, but ultimately it will. And there's a lot of resistance to that, and people just kind of want to do like the most straightforward and at the time economically sound decision. So he acknowledged that there's a lot to be done. He seemed to say that it's not something that is totally kind of squashed to the side, but it's also not something of priority right now, at least to VCU Health, which, although disappointing, was not exactly surprising. I think in general, like in our curriculum, we had one lecture hour with our immunity and infection unit where it was specifically focused on environmentally related diseases and how climate change has impacted that. So kind of learning just about that in that lens. But I think, again, in a lecture format, it kind of, the gravity of the situation gets easily swapped for, okay, what information am I going to be tested on? And it's not as much of a discussion and kind of active learning environment. So I think ultimately, like there's so much that can still be done and room for. I think it's exciting for me now, and just to be leading this group of people who now kind of have a little bit more of a fire ignited, I would say, and an interest in and getting more involved and being a part of the change that we hope to have. So I think it's really nice to kind of now have this group of people and looking ahead, planning some events where we kind of continue to grow that and inspire people to now get a little bit more actively involved in terms of being advocates for this awareness too, because just as much as it is important to, like I mentioned, getting back to the roots, being outside, all of those really valuable things where policy can build from, I think it's still important to then be making those action steps and kind of reaching towards that. So those are my updates, I think.
Go ahead and just minimize this a bit. I realized that I was away for a little bit. Okay. Any questions for Eleanor about her experience and leadership at VCU?
Great presentation, and really exciting to see how like young and enthusiastic and ideas. I definitely understand how hard it is, like thinking about things and like kind of balancing kind of what's what's right for a larger organization and then kind of what's right for the future and thinking about the future, which I think plays into politics also. Have you considered having patients join and kind of discussing what the impacts of, you did say like therapy, and I was thinking more like cognitive behavioral therapy or like the improvement in mental health when you're in green spaces, but there's also good research on the cardiovascular benefits of being in green spaces and, you know, kind of having journal clubs out there maybe related to that and going over different evidence-based journals with family med students or with medical students also, but then also like the other hand is how do you get patients involved because this is part of their community and showing them like, you know, part of your therapy could be for hypertension, you know, like exercising, but then also going into green spaces has shown to do those kinds of things. Just ideas, but I think it's really great what you're doing.
That's a really wonderful suggestion. I had not at all considered opening up that space and I think that that would just be really beneficial for patients. Because I have seen, yeah, like definitely what you mentioned in my research, there's so much room for that like cognitive behavioral therapy through nature and it's amazing like how much that's kind of taken hold in Europe and in Japan and treated with as much like validity as like a preventative care mechanism. But in the US, it kind of gets like, oh, if you have time or if you think of it, but like first do these things and take these meds. And I think a lot of patients are left feeling kind of hopeless and helpless. And I think that could be a really empowering thing for the patient to be learning about these things that they have access to and they can kind of do on their own volition. And like in taking care of their health and taking those action steps. So that's a really great idea. Thank you.
Any other questions?
Yeah, but and I don't know if this is so much a question or maybe a future thought as you go forward. VCU is such an interesting school, of course, because you know the campus is everywhere. It is all through Richmond. And as you were speaking and talking about the development of this green space, I was thinking about all the different neighborhoods and how very different, you know, when you walk through Richmond, it's different block by block. There are these tree-lined wide streets, and then you turn a corner and you're in Jackson Ward, and the streets are narrow and there's less tree canopy, and the houses are closer together. And it's just such a different feel block by block. And I was wondering if that's something even that you talk about within your medical school or within your student interest group about how you care for patients, but you care for communities. And it sounds like you're already caring for a community. Just kind of how do you think about that, and is that a conversation that you guys have?
We do have a course at VCU called Physicians, Patients, and Society. And it's one of our longitudinal courses. And they do have, we focused a lot on the history of Richmond. There's a lot of really wonderful like data that they've shown, just showing the disparities amongst the communities. And how like we as physicians then can navigate those types of conversations and approaches and practice. I think a frustrating part of the placement of the course is that it's often, and this is not a fault of the campus or the school, but it's like at an inopportune time where other students are like not exactly focused or engaging, and it kind of becomes like a study period where people are just kind of doing their own things. So it's very frustrating to see because these are kind of the courses that are so crucial for shaping like our future practice, and you never know like what someone could like kind of grasp onto from that. But I think that unfortunately people aren't even allowing the opportunity to. So I think I appreciate at VCU that they are doing that and they are educating us on that and the challenges that they're experiencing as clinicians in Richmond with their patient population. I think it's just the unfortunate reality that it's not resonating with everyone or people aren't allowing the time to.
All right, one more question.
Just actually an idea based on the previous conversation. We have recognized that VCU has a great school of the arts. And maybe there's opportunity for engagement with them and some of the work you're doing in outdoors and nature, and just a thought.
Yeah, their arts program is wonderful, and I appreciated your comment a lot about including that, and I think that there's so much space for that. And in the hospital, they have a lot of different art displays like that are constantly changing, and just recently they had one with all children of healthcare workers. So it was just all like their art lining it, and I loved like seeing it, and it just kind of like lightens up the place a lot. And I think that that would be a really interesting opportunity to have lead some sort of initiative to get art created somehow, whether it's at the school or through the community or through the hospital, specifically like environmentally themed, and just getting people engaged with that, because I think I saw a lot of people looking at it, and a lot of people were just and otherwise like kind of just dark hallways. It's something to look at and to engage with. So I think if there was definitely more of like an environmental focus, that could be really a cool opportunity.
Well, thank you so much for all the work that you have done at VCU. And we're all right. So next up, you have a presentation from the Shenandoah University School of Health Professions. Elizabeth Combs is online, and I'm going to go ahead, and I think you should be able to share the screen if you like, if you do have slideshow. But let us know, Elizabeth, how we can display things.
Oh, no, it's okay. I can just talk if that's all right.
Absolutely. Okay, so you're front and center on our screen, so feel free to chat at any point.
Oh boy, well, thank you. Good morning, everybody. Elizabeth Combs here. I'm a clinical phase PA student at Shenandoah University, and it is an absolute honor to be representing Shenandoah University. I'd like to thank Dr. Snow. He's kind of a celebrity at Shenandoah. We think a lot of him, and I really appreciate him inviting me to this event today. I have a lot of things that I'm really excited to talk with you all about today. So first and foremost, Shenandoah University is working on an environmental report card for the PHRC, or the Planetary Health Report Card group. For anybody who's not familiar, the PHRC is a metric by which different schools and health professions can grade themselves on the basis of conservation and sustainability. And in my experience working with the team the last year approximate, I've noticed one of the best things is not only highlighting what Shenandoah is doing right, but also picking out aspects that we can improve. That has been delightful in that it's opened up avenues for conversations about being better. And I love that opportunity. So that being said, though, we've also been able to pick out a lot of things that I think we're doing pretty well. Curriculum-wise, we have a professionalism course in which we have an entire class day devoted to learning about environmental impact on health. This is a lecture that, at least for my class and the class below me, was done by Dr. Snow. It's a wonderful lecture in which he provides a lot of resources and information on things that we'd already learned a little bit about throughout our curriculum, but he really dived deep and let us have very valuable conversations. Not only that, but Dr. Snow does an entire elective that is based on environmental wellness and healthcare, and supplies readings and different opportunities to talk about these things. Unfortunately, I personally was not able to take the elective, but I had a wonderful classmate who was willing to share the readings and materials with me, so I have been following along, and I hope Dr. Snow will talk more about this because it's an absolutely wonderful elective and an incredible opportunity for us at Shenandoah. Throughout the curriculum, not even just within the elective that Dr. Snow does, we have different aspects discussing environmental wellness and the effect on healthcare, specifically in regards to things, of course, skin cancer, COPD and asthma, and infectious disease. There's a lot to be learned in PA school in a short amount of time, but I really appreciate that our professors are willing to go above and beyond, take that extra time to discuss these important issues, because not only does it hit home to us as students how important these issues are, but it also gives us the language and vernacular that we need to be able to discuss it with patients. We had a course in our clinical phase year. It was last semester called Health Promotion and Disease Prevention. And during this course, we had a unit that discussed One Health, something I had not even heard of before this class. And basically, it's an approach to public health where you take in several different aspects, the big three being human well-being, animal well-being, and environmental well-being. We were given an entire assignment where we discussed and researched an aspect of healthcare that could be improved by the One Health approach. So taking in those three pillars and considering them. And after doing that research, we had conversations on, well, what can we do? And I had such an incredible time in that assignment, learning not only about the topic that I researched, which was sustainable farming, but also the topics that my classmates researched. Some of the topics included zoonotic diseases, antibiotic use in livestock, things of that nature. And my classmates had some incredible input. And again, having those conversations in class with each other opens up avenues to having them more in the future. That being said, I really wanted to thank you again, Dr. Ahdoot, for your discussion this morning, because you were exactly right. I am from I'm so southern in Virginia, as southern as you can be without being from North Carolina. So I'm from an area that, exactly like you were talking about, that climate change denial is pretty rampant, unfortunately, because it's considered such a political concept. You bring up climate change and people get upset, but if you can change your way of thinking and way of speaking, perhaps you say things like, yeah, the tomato haul wasn't that good this year. Or, yeah, my neighbor lost 6 calves to blackleg this year. Those are the things that perk people's ears up and the conversations that I've noticed people are more willing to have. In their defense, though, blackleg's a lot easier to say than Clostridium chapeau, so that's fair. Um, recreation-wise, we have several wonderful programs that I am very proud of. Our student organization, SUPAS, has a specific position called the Green and Wellness Chair. And one of the biggest things that this position does is send out bi-weekly newsletters about personal and environmental wellness. And our chairs, I love this so much, always include a little tip about conservation and how to be environmentally aware, especially during graduate school. Our most recent one, I did some research before this and just checking it out. She had included a clothing drive and some data backing up how much clothing waste contributes to environmental disparities. So that was really powerful and gives us opportunities to be more green while in this program. We also have a lifestyle medicine group who was started by one of my classmates, Naomi. She's a very good friend of mine, and in which we have semi-regular meetings discussing the pillars of lifestyle medicine, 2 of which are eating whole foods and plant-predominant nutrition. We, of course, know that this is good for the environment and that these types of diets release less greenhouse gases, use less land, use less water, and also, of course, in that umbrella term of lifestyle medicine is environmental wellness, getting that being in those green spaces, being outside, enjoying nature. And in order to be able to enjoy the environment, we have to be taking care of it. So this is another good way to start those conversations and find common ground, regardless of political affiliation. We also have a run club, which is another good opportunity to get some time outside. And something that I have seen that's really warmed my heart is every now and again we'll bring plastic bags and just pick up trash as we're running. That's really special. We even have little grabbers that we've gotten together, and it's just a great time and another wonderful opportunity to take care of our Earth. As we have been working on the planetary report card, our committee has started a environmental wellness group. And as of right now, we are not doing as much as we want to. We're still kind of getting things up and running, but so far, it's been a wonderful space to share articles that we have found, to just talk about events like these. It was through the environmental wellness group that I shared the information about this day that Dr. Snow shared with me. So hopefully that reached some people. And then last but not least, one of our professors, he teaches anatomy and some of our clinical medicine modules, Dr. Richie Gilbert, PAC and Doctorate in Medical Science. He authored his doctoral thesis last year about green spaces. It was specifically titled Physician Assistant Student Wellbeing, Where Do We Go From Here? It was published in the Journal of Virginia Community Colleges. And in order to partake in this research, he built us a garden. He took an area on our campus, added the boxes that we needed, added seating, and now we have a beautiful garden with flowers and produce, and it's a really wonderful place. As you can imagine, the research that he collected via the surveys that he took showed that this green space was very valuable to our mental health. I can personally attest to the fact that I've spent a lot of time out there studying. He's even got a place that we can set up hammocks. It's been delightful, and the more research that we can get backing up showing how valuable green spaces are to students, to the community, etc., the more, again, it will become instead of more of a left or right or political agenda, it will become this is something that benefits everybody. It's not nearly as political as it unfortunately has been made out to be. So I personally am starting my doctorate in medical science in January and am thinking about projects maybe not in the same vein per se, but definitely environmentally oriented. So if anybody has any ideas, I will absolutely send out my email. I'd love to talk about the best possible project to show how important these conversations are.
All right, well, thank you so much. Questions from the audience?
Excuse me. Excuse me.
Elizabeth, thank you. Thank you for your kind words, but I was just gonna, you mentioned the planetary health report card a couple times and just sort of what obstacles and what benefits you've seen from this so far.
Yeah, absolutely. So the biggest obstacle is the fact that Shenandoah University would be one of the first, if not the absolute first, PA program to have turned in a planetary report card. And the issue with this is that there wasn't a template made for us. The medical schools have a kind of pre-made template that you put your information into based on your program's curriculum. And we didn't have that per se, and it caused a little bit of issues with turning in the report card. Oh, I'm sorry. Oh, sorry, I thought someone
No,
said.
go ahead, go ahead.
What was I saying? Oh yeah, so that was a big barrier last year, is getting all the information looking exactly how it needed to from the lens of a PA program versus a MD or DO program. So that was the biggest obstacle so far. But luckily, Emily, the vice president of the PHRC, has been working pretty one-on-one with me the last little bit in getting that worked out. That although it still has been a little bit of a struggle just trying to figure out exactly what we need based on our curriculum. The benefits, like I was saying before, it makes me very proud as a person who has always cared very deeply about the environment. I grew up on a farm. You can't grow up on a farm and not care about the environment. It's simply impossible. But it really warmed my heart to see how out of our way our program goes to cover these important topics. And also finding the gaps, finding the things that we weren't talking about, finding the new ways to discuss these issues with patients. There was a question earlier about bringing patients into these conversations and these projects that we're doing. And another one of our professors, Sheila, is a lifestyle medicine cardiologist. I'm sure it has a fancier term than the things that I'm saying, but she does cardiology through a lifestyle medicine lens and has these incredible large group, let's say hypertension or diabetes discussions in which they will have at clinic, they'll have a meeting at 6 o'clock on a Wednesday. That's just a random date, where several patients within the clinic who struggle with issues with diabetes will meet together outside. A dietitian will come and walk them step by step on how to make a healthy meal or prep for the week. They'll eat a meal together outside, spending time in the sunshine. And those things, finding those things in our curriculum and those things in our professors' day-to-day clinical activities, that has been the biggest benefit for me personally, because I graduate in 2 months. It's about to get real, and I want the tools to be as good of a provider as I can possibly be, while also honoring the environment that I love so much and showing that honor to patients.
Well, thank you so much, Elizabeth. I would say, like I mentioned before, many of us have learned about the connection of climate change and health when we are practicing physicians and clinicians. So you're actually way ahead of us. So don't worry too much about getting all the tools that you need. If not for the planetary health report card, and this is one of the projects that many schools do take up, and I think for many schools that don't have a formal student interest group or club or anything in the curriculum, that oftentimes is a good starting point to generate interest and kind of get a sense of what the schools and programs are doing when it comes to environmental health. So we'll have a presentation of that in a bit from UVA, but I do want to thank Elizabeth for being here and presenting with us and for all the good work that you're doing. All right. Well, next up, as VCCA is named Virginia Clinicians for Climate Action intentionally, really for the purpose of including all health professionals. And so, physicians, nurses, our advanced practice providers, or any of the allied health professionals that are working with our patients. So as we walk through our profession, we're going to get to the profession of nursing. So I'm going to introduce Beth Tremblay come up and tell us a bit about what is going on in the Old Dominion University School of Nursing. So with that, let me just pull up the slides real quick.
Thank you.
I really appreciate Eleanor and Elizabeth being able to just talk.
I'll be using a cheat sheet. This comes sort of a little bit more from a faculty perspective. So I really love hearing the student perspective and walking through all of these things and meeting these challenges with no previous experience, really. Like, you're learning as you're going, and I'm already learning from you guys, like what your challenges are, and thinking about, okay, what can we do? So one of the things that we were talking about, and I really appreciate Elizabeth, you discussing that. Thank you. The planetary health report card, because this is something that we haven't been able to do yet. And it's almost like even a challenge to get to the process of how do you do this and how do you organize it. So this year I have a wonderful student, I think she's on mine, Haley, who's made contact with the committee, and they're like, oh, there's like an open enrollment time. And so they'll call and make contact at that point, in which case Haley will be graduated. So it's so bad. So we're on the recruitment list for next year, which I feel like is huge, that at least we have made that much progress. And so my job then is to look at kind of pulling together a student interest group and giving some structure and support to our students who are interested. And my thought is to tap into some existing programs. We have a really robust student nursing association. They're really active. And there is some preliminary interest there. So I've got a couple of people who are interested and really want to learn more. And I'm hoping to also expand this into our graduate program, because we do have master's degree and doctoral programs within nursing. But the goal is really student-led community projects, and really getting them to make that connection between practice and research as well, so that there's something to pass along and talk about. So over the last couple of years, we've very intentionally created some curriculum opportunities for students to understand. One of the first things that we did was integrate the Eco-America Ambassador training, because it is so wonderfully comprehensive and really easily accessible. This is something that students can do at home. So it's, about 2.5 to 3.5, I can't remember, about 3 hours of really good training that really walks people through that connection between environment and what you're going to see in your patients, and maybe what you're experiencing. And so this year we were able to expand it into the graduate nursing program. So that means an extra 140 or so students every year. So we're hitting about 280 students a year who are going through this program and at least having some kind of knowledge of climate and health each and every year. One of the student projects we were able to do this related to the environment and climate change was a disaster preparedness project, where the students really thought about what would somebody need. Where we're located in Hampton Roads sees a lot of flooding, a lot of hurricanes, so it's very relevant. It's very relevant to people's day-to-day life. They understand this because they've gone through it. And so then you still, I'll stand in front of the class and go, okay, how many of you guys have a disaster preparedness kit? I get usually 1 to 2 hands up, and these are all people who have been in the military. It's very, very interesting. But what we were able to do is go out into areas of community where people probably don't even have the funds to buy basic supplies. They probably, they just don't. And so disaster preparedness is not a big thought. It's, what will I do if I have to evacuate? What will I do if? And then they don't have the answers themselves. So it was really meaningful to be able to go into communities, give people some tools and some resources. And one of the little things that you see up here is a fireproof bag that is fireproof and waterproof, and it's about this size, which means all of those important documents can go in there. So talk about having a go bag in an extreme situation. That's your grab and go. That's your lifeline if you can only take one thing with you if things get really bad. But this also added to this one-on-one conversation students were able to have within the communities about climate, about environment, and about what people are really actually experiencing. So that was a lot of fun, and it was a good kind of scholarly activity for the students. Now, some of you guys from medical and PA schools have really talked about where is the curriculum. So I just kind of put up a slide for nursing. We do sort of have a mandate, if you will, to include this in our curriculum, because we, one of our big accrediting agencies and really guiding agencies is the AACN, American Association of Colleges of Nursing. And we have these things called the essentials of learning, and they have 10 domains, and one of the domains is population health. And within population health, we do look at climate, we look at disaster, we look at emergency, and all of those things we have to think of in the context of what is happening right now and what is happening in our environment and how are things changing, and thus how do we need to change to be able to look forward and prepare, and on the other side respond. So we do have some places for that. So I thought I'd just throw that in, and sometimes that's even from a student perspective, as you're looking at a curriculum from a student perspective, you can kind of look back and say, well, what are the guidelines that guide our curriculum? And that kind of gives you a bit of a voice as you're trying to make changes for the curriculum for the next group of people who come along, right? And just being able to say, hey, this is why we want to include this in the curriculum, and this is how you can do it, and this is your justification that in fact you should do this, and this is why. I just kind of threw up some of the publications, presentations, that sort of thing of just this year of what we're doing within the School of Nursing and some of our faculty, as well as the top one is the student-driven publication that came out based on their little climate project, which was really exciting to be able to work with students to really get them through all stages of a climate related project into a scholarly dissemination. And that's kind of what we got. So I look forward to getting ideas from all of you on how I can better integrate this process of student interest groups and the planetary health report card. That is definitely our next goal. So hopefully next year I'll have a student presenting this. Oh yeah, questions.
From the audience. I can start with one. There are a lot of nurses out there. I think as a physician walking through the halls of the hospital, I'm outnumbered by the number of nurses in each unit. We have really been intentional about engaging all health professionals, including nursing. There's also a lot of movement within the profession of nursing, whether it's from unit to unit, from degree to degree, specialties and practices. So can you tell me a little bit more about how that may pose a challenge or benefit when it comes to nursing engagement?
I think that one of the big challenges that we really face is really an inconsistency in curriculum across different schools of nursing, which probably is the same for schools of medicine. So it really takes peer-to-peer conversation and to impress and say, hey, here's our curricular mandate. These are our essentials. It's essential, to be able to come from that place of being able to say this not only can be electively introduced into your curriculum, but that it must be. And really giving people a strong rationale for why, and then providing tools on how. Providing tools on how to do it, that it is not a major. So as overloaded as students are, I would argue that oftentimes faculty are as well, simply because we are always responding to changing demands and the next sort of thing that needs to happen in our school, or hiring more faculty, or doing interviews for the next group of students. There is always something pressing. There's always something kind of more important in terms of what to do next. So to be able to kind of give another faculty member, this is plug and play, like you go ahead and start with that Eco America ambassador training. Put that in your curriculum. It's something your students can do on their own. You're just going to see their certificate. It's really easy for you to do. It is a great program. Somebody really worked hard to develop it. Let's use it. Let's get it out there. And then you can build upon that. And so you can kind of have that flipped classroom sort of experience where people can come and they can share their experiences, that exactly what you're talking about in terms of being able to speak from your heart and what your own experiences are can be really meaningful, so that you can have some of those peer conversations within a class, which seems to really help the students solidify what they've learned, but also think about, well, if I feel this way and my peers feel this way, probably my patients feel this way. And so maybe it is okay to talk to people about it without being afraid of that political, being sort of looked at like, oh, you're politicizing something. We talk about this a lot, is like, this is not about politics. This is, yes, policy affects patient health, but this really is about caring for one another. This is about taking care of each other. That's why we're here. That's what we're meant to do. And then how do we put that into a curriculum across nursing? That is definitely a big conversation. So we try to publish, and we try and offer tools and tips and how do you do this. And then another thing that Janice Hawkins and I do is we look at, like, how do we get this stuff out to the community through op-eds. I write a monthly health column for my local newspaper. And boy, do I focus a lot of the environment. This is what this means to you. Yeah, you felt hot. This is what it means. And hopefully empowering people to take those, take what we know, what we all know, and translate it into day-to-day life, and in hopes that they do have some language when they meet their primary care provider, that they've heard this before. They are primed to have this conversation and then can integrate it with their own experience. If we can do this and show people how to do it, whether it's teaching nurses or teaching and empowering community members, I think then we start to all get, we all start to speak the same language at some point, hopefully.
And I'll just add a comment to that you made me think about, and I was thinking about with our other speakers, that in the microphone for those online, with us being specifically for nurses, but I think with all of us being frontline clinicians, but we touch all the things in medicine, and so we could be really responsible for reducing waste. And when you were talking about the VCU, some of the things save money. So I wondered if, I was going to talk to you when we had a break, that I wonder within our clubs if that should be also part of what we're making as one of our initiatives, is to help reduce the waste that's there. And I guess when you mention nurses, with so many of us and we touch everything, we're good ones to say, you know what, we throw this away every time we open this package. Let's take it out of the pre-made package and only open it for special occasions or things like that. So that's what I thought of when you asked your question too, is if we're the ones on the front lines, we know what's getting thrown in the trash can and where we can save there.
100%. So VCCA actually does have a health sustainability subcommittee that looks at healthcare systems and how we can reduce waste. And a lot of those efforts have actually been money saving as well for the healthcare system. So we do have, they actually just had a featured speaker from this past month at the monthly meeting. He is clinical technician at Innova Fairfax Hospital and has done so much work in that waste reduction aspect. And yeah, I think these are definitely opportunities for curriculum, but also opportunities for scholarly projects for each of the healthcare systems. So students, faculty, I think these are really just opportunities to just do a little something that can help boost your credentials, get a great experience, and also help our patients and system in general. Thanks for the last comment. Yes.
Beth, thanks. I just have one quick question. If it's in the AACN guidelines, is it reflected in accreditation or
Yes.
exams? Okay.
It is. So my understanding, Nurses after graduation there's a national board that they sit for. Because there are multiple levels of entry into nursing, it gets a little tricky because really that exam is a basic safety exam. However, I have heard that more and more we're going to see more that is related to things within that population health. There are already some things, does tend to be focused more on disaster preparedness and response, specifically on disaster response. But I think it's a growing interest because it's a growing concern. So, yes.
Fantastic. Well, thank you.
Thank you.
Right, so one more presentation before we get to our break. So we have Nadia Ali coming from Georgetown University School of Medicine. As we had mentioned before, DC, Virginia and Maryland certainly are in close proximity to each other, and we all have patients that are in the Commonwealth. So really excited to hear from Nadia. You've been doing at Georgetown.
Hi, everybody. My name's Nadia. I'm a fourth year at Georgetown in DC, born and raised in Woodbridge, Virginia. I suppose. Before I started, I did want to shout out my M1 who's here, Amber. We have, it's not just all faculty, there are students that are heavily involved in this as well. But yeah, these are our updates in terms of like our Medical Students for Sustainable Future Club at Georgetown. So first, I wasn't sure what I was supposed to do with this presentation, so I just gave a little bit overview of like Georgetown University and what they're doing in terms of. So the overall campus, on the main campus, they do have an Office of Sustainability, but there's no GUSOM like School of Medicine or a university hospital affiliation with that office. And they do have some like pretty lofty overall goals, which to my understanding, they are working towards meeting with like carbon neutrality, water positivity, and 100% renewable energy by 2035. In terms of the medical campus specifically, in our medical school buildings, we already have 100% renewable electrical energy, which is very good. And we have single stream recycling available on campus. And then there is these like longitudinal 4-year academic tracks that each student gets to go in.
They shut down that track recently. The professor who was running it retired, and she is now a professor emeritus, but she no longer heads it.
You know, I have updates for you. It's back, guys. They found enough. I think Dr. Wellberry, the one who helped us found our chapter, she actually came out of retirement gratefully, and she's leading the track again. So
she'll come next time.
It was kind of up in the ether for a little bit, but it's back. So these are like 4-year scholarly tracks that students have. They choose them end of first semester of their M1 year, and it's like a thread through all 4 years. They just like work on things on scholarly projects and like volunteering and all these different things. And one of the options is environmental health. It wasn't an option in my year, so that's why I'm talking in vague terms because I don't know what it is, but it is back, so that's good. And then in terms of our chapter, we were founded in 2019. Dr. Caroline Wellberry, now she's retired, but she was like a very heavily like involved in terms of environmental health on our campus. And then currently we have like 80 plus members on our list to serve. So we're growing and growing each year. So what we're doing. So me and my friend, we took over the club 2 years ago, right before Step 1 dedicated. So of course we didn't do much for those first couple of months, but we've been getting back into it. And then these are just some of the things we've been doing. So the first one is integration into preclinical curriculum. So there's this 1-hour lecture that just recently became incorporated into our curriculum titled here, Climate Change and Health Inequity, Structural Racism and the Climate Gap. So a group of students and a climate psychiatrist, Dr. Wang, got together and they put these like slides together. That's 1 hour. and then half from student-run clinical vignettes that are just about like environmental health and how they impact our patients on the day-to-day basis. They are doing some student surveys pre and post the course, just like to evaluate their understanding of climate health, and a manuscripted progress for that. And then we've also slowly but steadily tried to incorporate ourselves into the core curriculum for the preclinical students. So we have like certain blocks, CV, respiratory, IRD, the immunology. And we kind of just, how we do it is we will find what professors are giving certain lectures and try to find ways that we can kind of like make slides for them and suggest to them like, oh, you can incorporate these several slides into your lecture so that all the students are seeing it. And this is just one example of that, where older adults, like their cardiac output and their heart rate are changed in exposure to heat, which is very relevant. So we've been doing stuff like that, and that's personally what I'm most proud of. And then we've also been doing most recently like more advocacy work. So we just recently had an op-ed workshop with alum Dr. Tumala, if you guys know her. But just trying to get our voices heard out there because some of our members were very passionate about that. And we're just gonna have future office hours with her to prepare for publication in like different newspapers and things like that. And then also more like advocacy as well. So we host like clothing swaps, sustainable stitching. These are two of our members learning how to embroider so they can stitch on their scrubs and things like that. We had this idea of a career closet in our student health, like our student lounge, where students could kind of like drop clothes off their scrubs and kind of have this revolving closet for students who might be lower income and they don't have access to these materials. And we're doing that with partnership with the Office of Diversity, Equity, and Inclusion and Belonging at our school. And it was actually very surprising because we came in like very like, can we please do this? Can we please have some space? And they were like very gung-ho about it. They were like, sure, you can have some money too. Like here, you can do all these things. So it was just very surprising to us because we've been so used to this hearing like, we don't know. So it was very exciting to hear that they are excited about that as well. And then we also do newsletters on environmental events in DC. This is my favorite thing in my neighborhood. I think it's a DC thing only, but they have these compost bins just like throughout the city. So it's very convenient. You just toss your stuff in, and I love to spread the word on this. And then what we plan to do, or what we hope to do one day. So first, there are more collaborations with the Medical Campus Administration and the University Hospital Administration. In terms of the hospital, some ideas we've been having is like medical waste research, like we've been discussing. And I know there's a lot of expired medical supplies that go to waste, and trying to find a way to kind of use them in some way. In undergrad, I was part of this organization where they had like a whole warehouse. And I forgot the name of the club, but we would go and volunteer, and it would be like boxes and boxes of expired medical supplies, and we would sort them, and then they would ship them to other places in need that would like accept them and use them. And I'm not sure if something similar is happening at Georgetown, but I would love to look into it and try to get that working as well. And then there's also a Sustainability Council. We recently met with them. It's led by nurses, and they're more on like the sustainability aspect in the actual hospital. So we're working with them to try to get recycling bins in the hospitals back. And then in terms of the campus, our main idea is just getting composting bins on campus. They have them on the main campus and also the Capitol Hill campus, which is a different one, but not specifically on the medical campus. So we're working with them. They're trying to find a place that would best suit everybody. And then actually my first year, we worked with this organization that's more like the School of Pharmacy does, called Urban Herbs, which was led by a pharmacist. But this is the rooftop of one of our libraries that you can kind of walk on. It's like a second floor park-ish area, and it used to just be all like grass, so heavily hit by the sun. And then my first year, we were able to create it into kind of a garden using different, mainly like Texas plants that are used to more aggressive heat. And now it looks very pretty and people love to go there. So I'd love to have more opportunities to do green spaces like this. And then like someone someone mentioned the plenary health report card. Our club, or like the school in general, last completed one in 2022. It sounds like we can't do one this year from the presentations I've heard. Creating like a dedicated team to complete this for the next year, because in the last time we got it, we got a C+. So hopefully our school is doing better, but I think it's good to check in and kind of see what the organizations and administration are actually doing in terms of environmental health. And then just what I feel like starting, even when I joined this club as an M2 in these past 2 years, I think interest in climate health is changing and growing as well. I feel like every year more and more people are like coming up to us at the activity fair saying, oh, I would love to join. What can we do? And there's more passionate people each year. And then in terms of what we're doing, I feel like a lot of the lifestyle advocacy ones where we're just like, it's like a nice, easy, low effort way to kind of like reel people in and try to get them involved in the madness of like, oh no, now you should do this, you should do that, you should come to this meeting, of like trying to invite people in a very healthy way and like chill way, honestly, to just join in on the club and what it's about and all those different things. And also at the same time though, like have big asks. I feel like putting your foot in the door is the way to do it sometimes. You'll never know who will support you. You know, you can have people you never thought who will give you like funds and funding and all that. And then I think specifically, last one is we don't really have a roadmap. We're kind of just like a group of students going through life, going through like medical school, going through all this and trying to do this club as well. So there's not a lot of like expertise, I would say, in our school, but that's why hopefully we're coming to things like this VCCA, trying to like meet more like faculty mentors and what they've done in the past and try to emulate that as we go forward. But I think, yeah, that's it.
Questions from the audience, Ursula?
Thank you, Nadia, for that presentation. I went to Georgetown, so I'm very passionate about the university as well as then all the great work you all are doing at campus. Relating to that, I'm curious if you have worked at all with the Earth Commons. It's an initiative that's at the undergrad campus, but kind of goes throughout the different grad schools that focuses on environment and health, just as background for folks that aren't at Georgetown, because that might be a great resource in terms of some of these other initiatives.
Yes, we're definitely aware that the undergrad campus has like Earth Commons. We haven't reached out to them yet, but I think I really want to work on the what we do with these expired supplies, and I feel like there might be an undergraduate like representative that might know more, just because I know when I was at BCU it was like undergrads who ran it. So I feel like we will definitely reach out in the future, yes.
And, that's part of our, sustainability, healthcare sustainability subcommittee focus as well. And I know there have been efforts to sending them to overseas, for example, but even our simulation center, for example, at Nova, has really been an avenue for a lot of these medical equipment streams, so that they can be used for the purpose of teaching and not on actual patients. But yeah, I think another scholarly project idea that can certainly be implemented, and anybody that has a passion can run with it.
I'm one always asking questions, but this is more sort of, I think the other schools might be interested in your op-ed sort of interest, because I think it's applicable to numbers of groups in different schools. And I just wondered if you wanted to go into more of that.
Sure. Some of our students were, honestly, I'm not much of a writer, to be quite honest, so this isn't my interest, but a lot of our members voiced interest in wanting to write like an op-ed, basically like from the perspective of a future clinician, how this changing landscape of climate and like climate change and the increased politicization of it will be impacting us as clinicians. And so we just got together. I think when we reached out to VCCA and trying to get there's a workshop going where we will have the first, it's like a series of workshops. The first one was just the physician going through like what an op-ed is, how to write it, the different strategies for it. And then we're going to be having like almost mentorship, where we will have like open office hours that like students who have written an op-ed can come in and talk to like experienced clinicians who haven't published these op-eds, try to edit them and get them in a way that they can have them published and make it more like a scholarly report instead of just like an idea we have. Because I feel like we sometimes are like, oh, we should do this, we should do that. And then a lot of the time, like you'll do half the work and then you'll get busy and then you'll forget about it. So it's a good way to like keep up with it. That's what we're trying to do.
Any last questions? All right, well, thank you for all the work that you're doing at Georgetown. So we're quite on schedule, and let me just make sure that we do that. Okay, so next up, we will have school updates, more school updates and research presentations starting at 10:40. So we'll have about a 10-minute break. Do help with our waste reduction by finishing all the food from breakfast before lunch comes about. And in the meantime, I also put up a different QR code. So this is introducing the Medical Society Consortium on Climate and Health. And we're really grateful with the consortium as a national organization that have supported the beginning and the growth of VCCA throughout the years. And have partnered with us in hosting this event in this beautiful space. So look at the QR code. This is really looking at this issue in a more national level. They do have a yearly meeting that will likely be in the same space.
Yeah, we're gonna be in that whole auditorium space over there, maybe upstairs.
Yep.
I mean,
So with healthcare professionals across the country, and then having an opportunity to do some advocacy work as well on Capitol Hill. So we're going to take a break, and we'll come back at 10:40, and we'll get to the next part of the program. Thank you.
have a throughout the chat and then.
We're gonna get started again.
I want to talk to you. Besides that.
All right. So in this next hour, we're gonna have three presentations. I think practically in terms of how things have been moving, I'll spend some time introducing a worksheet. So I remember one of the presenters was talking about a roadmap. I think it was Nadia that was talking about just it's nice to have a roadmap to see where things are. And I'll give a little preview when it comes to a worksheet that we have sent out ahead of time and we'll send out again. I think there are some years that we've actually allotted a little bit of time for the workshop, but we also have a lot of great presentations this year, and I want to be able to hear from everyone. So we'll get started with the next school. We have UVA School of Medicine, Selena, Alexia, and then Vishal. I don't think he is here virtually, but he was part of the crew putting together this presentation for us to talk about what we have been able to do at UVA School of Medicine. So I'm going to put up the slideshow and actually I'll try to move this audio setting. And I'll leave the floor to you guys.
Hi, my name is Selena. I'm a second year medical student with the Student Clinicians for Climate Action.
Hi, I'm Alexia. I am also a second year medical student with the Student Clinicians for Climate Action at UVA.
And Vishal isn't here, but he helped together the slides. He's graduating soon.
So our focus in terms of presenting what UVA School of Medicine has been doing is primarily through our planetary health report card. So overall, I know there are a lot of lines, lots of colors, but I guess the most notable one is our black line. So the overall trend over the course of 5 academic years has been general improvement. And we can focus on the curriculum trend first and foremost. So in between the last 2 academic years, there hasn't been a significant change in how curriculum scores have improved in our PHRC. In every single preclinical system block, with the exception of our musculoskeletal system, there has been some element of planetary health incorporated. Most of that entails our learning objectives. They would have some mention of like understand how environmental impacts like affect neurological health or something along those lines. Oftentimes, though, it doesn't incorporate any details other than a learning objective. With that said, in our neurology and psychiatry block, we had like one slide that mentioned there is like relationships between heat and stroke frequency, as well as migraine exacerbations. And coming up in our pulmonology block that we're in currently, in 2 weeks, we're going to have a lecture on pulmonary health and climate change. And then in transitioning from clerkships to post-clerkships, there is a required bedside to community course for 4th year students. And according to Vishal, who is in his 4th year, he said that they have incorporations of climate change and relationships to health. And as many people have mentioned, 4th year 2-week clinical or elective that 4th year students can take is the climate change and health course. And ultimately, in looking further into improving our curriculum, we ideally want to cover climate change topics more thoroughly beyond just objectives. Next up, we're looking at interdisciplinary health in our PHRC, and that's the one that's like generally consistently been the highest. And that is because we have the UVA Environmental Institute for Interdisciplinary Health, and it's a fairly large group composed of environmental science, environmental engineering, public health, and people associated with the School of Nursing and School of Medicine. And they gather together and they have a number of publications relating to climate change impacting people's health. For example, how temperatures increase the number of emergency visits. And there's also the Translational Health Research Institute of Virginia, I Thrive, that connects researchers and community members. This one I was not as aware of, so I was looking at their website just a few days ago. And something to note is that while they have these things they call like research community studios to connect, to allow researchers to talk with community members, it has been stopped until further notice. And then they also had like a link for community members to join specific programs in relation to research, but that has also been stopped until further notice. So that's just something we'll keep an eye on. UVA's as a whole school has a sustainability website that centralizes campus resources. And our UVA School of Nursing, for I believe the past 4 years, they had hosted a health and climate symposium, but they're not continuing that starting this year. And so ultimately, our goals are to improve funding and connections with faculty, to encourage student participation in research, and to organize a UVA symposium, kind of to make up for the lack of UVA School of Nursing's symposium. And next we have community outreach and advocacy. So that's the one we have most room for improvement for, but general increase in how we're doing. So there are multiple events for sustainability during Earth Month catered to UVA students. For example, we recently had the clothing swap event, and then there's like a carnival market or something. However, UVA School of Medicine has minimal partnerships with community organizations. So while they do a number of things with the student group, their community organization involvement is a little lacking. The Inova Hospital, so UVA's other campus in Fairfax, provides online resources for patients regarding climate change impacts on health, but UVA's Charlottesville campus does not do that. And something recently that our social chair has been able to get done was the November-December edition of Medicine in Motion, which is a newsletter sent out to anyone affiliated with, I believe, the health system. That newsletter will include sustainability updates. And so ultimately our goals to improve community outreach and advocacy is to publish more educational materials on climate and public health for the general public and to increase collaborations with community institutions.
Thank you so much, Selena. All right, so moving on to student-led initiatives, we've seen a slight downward decrease, and actually part of this was due to just changes in standards for the Planetary Health Report Card, but that still doesn't mean that there isn't potential for change. And some of the positives that we've seen with student-led initiatives is there are opportunities for grants for sustainability projects, and we'll actually talk about an award we received a little bit later. There are programs targeted towards undergrad, master's, and PhD students. And then we do have a website with our club, Student Clinicians for Climate Action, that we routinely update with current initiatives, projects, and resources. And this fall semester, we're going to continue to update that with more some up-to-date information. And then we do have representatives, medical student representatives, who sit on the Health System Sustainability Committee that happens monthly. And we encourage them to message in our GroupMe with what new changes are occurring at UVA. For example, we just recently learned that the Sustainability Committee had talked about transitioning styrofoam cups to no longer be used in our cafeteria and instead use paper or biodegradable, which was a great update for us to hear. And then again, sustainable food systems panels and outdoor programs for students. One of the examples is Morven Farms, as an opportunity for students to go out there. It is a large green space. Me and Selena are newer to chapter leadership with Student Clinicians for Climate Action. So a lot of our opportunities we're looking at are kind of newer, and we're trying to see what relationships our club has had in the past. And I'd love to see more of our students go out to Morven Farms, for example. And I think Eleanor and Elizabeth had some great ideas for utilizing green space. And so I'll definitely be incorporating that into our future projects. So yes, again, improve on environmental justice, culture events, and local volunteering involvement. We hope to volunteer with the Botanical Garden of the Piedmont in Charlottesville to help clean them up. That is a project, if you're interested in learning more about, it seems to be very stagnant, and I don't know if you know much about the botanical garden there, but they do have opportunities to clean, and I'd like to update our website with
potential mentors and people to reach out, for example, at VCCA for our medical students. And then campus sustainability, we have seen a general increase. So we do have an Office of Sustainability with full-time staff, and recently we now plan for carbon neutrality at UVA Health by 2030. Previously, and well, currently, we primarily utilize fossil fuels still at UVA Health to support our energy. And since June of 2025, I believe, we are slowly trying to move away from fossil fuel use. And then new buildings will be required to be LEED certified. Our medical school is LEED certified, and old buildings retrofitted. We do have a bus system in Charlottesville, and I try to encourage my peers to utilize it. And it's not easy to learn first offhand, but I actually hope to have an event this fall with our journal club with some instructions on how to use the CAT, the Charlottesville Aerial Transit Bus System. There is recycling and composting available to students and faculty. I'd say recycling more so. The composting part myself, I'm actually not too familiar with, so there is a lot of room for improvement. We don't even have composting, I believe, at UVA Health that I've seen. And yes, partial divestment from fossil fuel companies. So we did submit our planetary health report card findings to the SHARE conference in 2025, Sustainable Healthcare Academic Research Enterprise. So that was a great experience for our club. And this year, my co-president Sriram actually looked and saw that the Sustainability Leadership Award was up for running. And so we applied and we actually won a great amount of funding for our club. So we've been coming up with ideas. Thank you. We've been coming up with ideas to utilize that funding appropriately. And so just some upcoming events. I actually assembled a group of medical students with VCHEC to attend the Planetary Co-Benefits of Healthy Diets webinar put on by Dr. Saad that I saw VCCA send out to us. So right now we have about 20 medical students. We're all going to gather in our auditorium at the school. I ordered some pizza, and then people who want to attend virtually, they'll be registering. So that'll be great to encourage some talks. I think something I've noticed at our school is there are just not a lot of conversation about the environment and planetary impact that I've seen. I'm an alum at Arizona State University, and they're #1 in sustainability in the country. And that's just something in every class that we were always talking about. And I would love to foster more of those conversations here at this medical school. A couple other projects that we're really excited about that SCCA is working on, something called the Capturing Food Waste Project. Dr. Matthew Myers, he's the Sustainability Committee co-chair at UVA Health. He has helped us spearhead this project. We learned that the UVA Health cafeteria wastes about 20 to 40 meals per mealtime. So breakfast, lunch, and dinner food is just being thrown out. I'm sure that is probably very similar for some of your medical schools and nursing schools as well, at your health systems. And so we had a meeting actually only last week with the director of the cafeteria, and we were brainstorming ideas on how to get this food to hungry medical students, of course, and maybe even residents. And if there are more leftovers, I work with a homeless shelter in town. I would absolutely be able to just haul it over there and people would be grateful. So we're currently brainstorming ideas for that and assembling a volunteer base of medical students who can go and pick up the food at certain times and bring it back to our medical school to distribute and reduce food waste. So that's one big project we're working on. The second big project that we're working on is our hopefully new medical school community garden project. This is something me and my peers have been emailing back and forth administration for the past several months. There's a terrace in our medical school that has these planters that kind of just have dead plants, and there's not a lot of it's this really nice terrace, and there are some benches, and people try to go and eat food out there, but there's just not a lot of seating space. It's not very nice. So we reached out to admin, and we're working with our student body president, and there have been talks to replace the planters. We could actually plant produce/flowers. We're actually looking to make, I don't know if I told you this, a memorial garden, because we unfortunately had a few classmates did pass away this past year. So we want to honor them with this new green space where we can also enjoy lunch and dinner. and hopefully journal clubs too. So that's something we're working on. It's a big project, and I didn't realize how much goes into infrastructure code. Like they have to like buy certain planters. It's a whole thing. So that's something we're working on this fall. And then a few community volunteering events. Again, like I mentioned, we'd like to volunteer with the Botanical Garden of the Piedmont, maybe the Recycling Center too in the fall. Oh, and the Ravenna Conversation or Conservation Alliance too. And then of course the 2026 Planetary Health Report Card. We're always continuing it, and we'll start planning that in January. And then just some pictures of our recent social events that we've had to start the year. But yeah, that's UVA. Thank you so much. And thank you, Dr. Y and the entire VCCA for having us.
Questions from the audience?
I'll always ask a question. You mentioned a number of things were closed recently, and I know that your former president resigned recently. He actually spoke at one of the conferences we supported in the past. And is this all related? Or do you know?
I will say, in terms of to what degree the change in leadership has impacted like medical students, we don't see it as much. And the fact, like, just after we came back off of summer break, which was when everything was really happening, they held a class meeting for us, and then our dean of curriculum education, she came and she was just like, generally everything should be smooth sailing for you all. She was kind of the one who's more perturbed because apparently all of her bosses were now gone, and now she was like head honcho. So in terms of how that impacts the community, like especially I Thrive, that I'm less aware of, especially because I Thrive isn't like UVA based. UVA just has some sort of partnership with it. So hard to say. I would lean more towards its government funding that is impacting it rather than UVA changing leadership.
And I'll follow up on that. UVA School of Medicine has done a really great job in kind of insulating the students from all the changes in leadership, and with the everybody that is involved in curriculum and student development and affairs. I think everybody is still in place, and the program in the school is just thriving and running while we're working on filling these spaces. But yeah, no, absolutely. I think the leadership and support continues to be there.
In regards to the objectives in your different curricula, do you have a problem-based learning or case-based? You have case-based learning?
Generally.
Yeah. So that could be an opportunity where some of the cases like that your different attendings are presenting may be health related. So if you have like a geriatrics, just a suggestion, like if you're doing a geriatrics course or something, having someone that's out in the heat during between hours of 10 and 4, or someone also saying like an athlete who's young and kind of coming in, but those could be ways to incorporate it into different subjects like infectious disease and, allergy, immunology, and so on and so forth, because in my experience, kind of every specialty is being affected by that. And I'm happy to talk to you guys more about that. Yeah,
I'd love to chat with you a little bit more. I think the struggle that we've seen in the past is, we can reach out and like help professors incorporate these slides, change learning objectives. But at the end of the day, it comes down to the passion of the teacher of these topics. And I think we've struggled with connecting with our professors and saying, this is why we think this is so important. And we're not just trying to check off something for the Planetary Health Report Card. We actually do want these conversations to happen. So I'd love to find more leaders at UVA Health in the Charlottesville campus. We're so grateful for you, Dr. Y, but I know you're all the way up in Fairfax. And Dr. Myers has been great too in having these talks, but within our like education and our system leaders, I'd love to see some change there.
I guess something that tied on to that, what I think may also kind of be a struggle is I would say a lot of our classmates are focused on how do you pass the exam and like what gets you the highest step 2 score, which is like probably our next upcoming big test at some point in time. And so generally, if there's any mention of anything that is not relevant towards step exams or like the summative exams that we take, people are less interested in learning about it fundamentally. And it's not like we could force them to intake information. So that's also something we struggle with.
Well, actually, I have a question then to add on to that, to open up to the floor. So something I've seen is we'll include learning objectives, which are technically testable on our exams, but I have never seen a single question on my exams related to how climate change impacts health. Would this be something we could encourage and just make students aware, hey, you will be tested on these topics, so please learn it. But I also don't want to encourage a culture of, make sure you learn it for the test. But again, that's oftentimes how students will read the material, because sometimes they'll just skip that material. And I've seen people do it. They're like, oh, I won't worry about it. I know I won't be tested on it. What do you guys think?
Have you seen that on the USMLEs? Any
So,
comments or thoughts?
yeah, I mean, I can take the first crack at it. It's medical school and all health professional school is busy to say the least. And we could see that with the overwhelming amount of material, then it's just human nature to just pick and choose, aside from some really strong interest to begin with to learn about a certain subject. So yeah, absolutely. I think the way to get to relevance is to include things, objectives, but also exams. And I think, the reason why there are exams is to test medical knowledge and skills. And the reason why we do that is because it is important when it comes to taking care of our patients. So I wholeheartedly agree with this being on the test because it ties into the objectives. And I think not just local tests in schools, but national exams and national curriculum and national objectives. So there is this approach of top down to say if the top societies and have this in the national curriculum, then it will filter down and all the medical schools will be able to adapt it. And in time, I think that's probably the way to make sure that university we have a robust curriculum on this particular subject. But in the meantime, I think we do appreciate a groundswell of support. So this bottom-up approach to say, this is important material, we do need to learn this. At the very least, we're going to have speakers and clubs to talk about the subject in that forum and then start to integrate things into the curriculum. So with both approaches, I think in time, it'll be a good balance. Julian?
I just want to add to that.
Thank you. So I've also been thinking about that because it's one thing to get students to show up to class and kind of do the bare minimum, but getting them to care about it, engage critically with it, maybe like hopefully get involved with it outside of the classroom is a whole different thing. And so I think having it be on the test is a good way to get people in class and lecture. But then to take it to the next step, I think people are kind of inherently self-interested, unfortunately, and a big part of getting people to care about climate change is showing how it could apply to their life. So one teaching strategy that I think could be helpful would be using like Turning Point, which is like a website that we use in lecture where students can answer questions, or using, I forget what the name of it is, but there's one that instead of multiple choice, you can submit like a word answer and it'll form like a word cloud. So you can ask like, what specialties are you interested? Get a sense of like maybe the 5 or 6 biggest ones, draw connections to what you'll see in your day-to-day practice in that specialty, or what region do you envision yourself practicing in? And then for the major answers, you could talk about what environmental challenges are you face there, or even on like a less medical side, like what hobbies do you enjoy? Do you like to go fishing? Do you like to go skiing, hunting, etc.? And just to kind of get people thinking, like, this isn't abstract. This isn't something I have to worry about 30 years from now. This is something that affects not only my patients, but also me and my family.
Thank you, Julia. Yeah.
Hi, as a medical student, I wanted to sort of gauge other medical students' ideas about this interest. Just taking a look at like the photos that you guys have posted, it seems like you have really fun, but it also seems really skewed by sex. And I'm wondering if you guys have ever thought about why, especially on medical school campuses, why it seems to attract or detract certain types of students. If you guys have ever thought about this, if not, no worries.
I feel like one is just largely speaking, there are more female people going to medical school compared to male humans. So it's so I think part of it is that, and then I think our class ratio is actually pretty good. Like we have 52% female, 48% male. And then it might go back to politics. That's honestly just fine.
Yeah, so our these bottom two pictures are actually our previous club members, and these right two pictures are like events from the past couple of weeks. And I will say our leadership does mostly comprise, well, actually, I'd say it's a good mix of men and women. My two co-presidents are men and I'm a woman, but I don't know. I feel like I understand that there are more. Yeah.
Genuine curiosity, because it's something that I've noticed both at also taking a look at these photos and then also sort of the composition of this room.
This is reflected across the entire climate and health movement, I would say, like a pretty similar ratio, maybe a little better to what's in this room. But in terms of leadership, which is it's just a phenomenon.
I'm Abigail Hank. Hi. I'm Abigail Hinkin. I'm an emergency physician in the Luray Blue Ridge area and board chair for VCCA. I was going to say, my husband is a straight man in the public health space, and to be frank, broadly speaking, when you start thinking about medicine as something that impacts communities in our society, you quickly begin to see gender balances skew. He's a bit of an anomaly in his space as well, in his conferences. I'm not going to dig into the gender theory about why that is, but
I think I can get into some theory because I just recently read a book called about weird people, and I don't know whether people have heard that acronym, but it's I can't remember what it stands for, but in any case, women tend to be more empathic. They tend to be more caring about their fellow human being than men do. And that's probably genetic, hormonal sort of, because it seems to skew across all sorts of populations. And so, you're going to be more in this space. But I'll look up the acronym for weird. And
Is that the name of what? Weird people?
Western, educated, industrialized, rich, and democratic.
Yes.
It's called the weirdest people in the world. But it's weird as in an acronym, so it's all capitalized.
Yeah. So if you didn't hear that, but can you say it one more time?
Sorry, yeah. So Western, educated, industrialized, rich, and democratic. Yeah. But as an economics major, like we also saw that, when I was in school when microloans became really, really popular, and majority of those countries, like in South Asia, that we gave our communities gave microloans, and Africa, you gave them to the women because of those reasons, because they allocated the funds a lot more democratically and distributed them to the needs rather than the men. And so we see this kind of imbalance in a lot of different areas as well. Yeah.
So maybe some of us just need to be less shy and be able to talk about the subjects that we're passionate about. So, all right. Well, thank you so much for
Thank you.
all the great work that you guys are doing. And I would say just at that, UVA has a really good running streak when it comes to putting together the planetary health report card and have a great team. So I think, those that would like to, learn more, be refamiliarized with that process. It takes a village, right? I think the team is what, 10, 15 individuals that,
Of our leadership, oh, like a PHRC?
yeah.
Yeah.
So,
15.
yeah, so
Big group.
it takes a good number of people, even if it's a yearly report, to provide updates and really kind of get the work done. So, and it's a several month-long process to get started. So, that just means more students and faculty have the opportunity to get involved from a scholarship perspective. And I will volunteer you guys to serve as resources for anybody that may want. And this is, part of the reason that we have this collaborative, is to share such ideas and experiences. All right. Well, next up, I'm gonna bring Ursula Gately up from Johns Hopkins School of Medicine. Ursula actually has history with us. She's worked with VCCA before starting her medical training career. So I'm gonna have you introduce yourself a little bit more, and love to hear what you guys are doing.
Yeah, thank you, Homan. It's fantastic to be here and see some familiar faces as well as then some new ones. So my name's Ursula Gately. I'm an M2 at Johns Hopkins. I went to undergrad at Georgetown. I'm also from Arizona, so I heard the ASU Connect, and I will be asking you about that later. So I worked with VCCA as the Advocacy and Research Fellow in 2021 to 2022. And I also, just as a disclaimer, I probably should have disclaimed this because I'll talk about planetary health in a second as a framing, but before I started in medical school, I ran membership and youth programming at Planetary Health Alliance. So I'll be talking about the landscape at Hopkins. So specifically, I wanted to just identify why we use the terminology of planetary health in this space at Hopkins, as opposed to climate and health. This is a question that I had. There's so many different fields: environmental health, there's One Health. So the definition, just to make sure we're all on the same team in terms of what we're using here, is basically planetary health is a solutions-oriented and transdisciplinary field and social movement that focuses on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. This definition is coming from the Alliance. Again, I'm slightly biased here. So it's climate change and it's everything change. It's a recognition that climate change, yes, is an integral facet of this story, but thinking about it, we've got many different other aspects present, whether that's biodiversity loss, land use or cover change, marine degradation, nutrient overloading. This is a pretty robust graphic that I'm happy to send out after. Again, it's from the Alliance. It's from Sam Myers and Carlos at the Alliance. It basically goes through underlying drivers of the systems we have, then the environmental changes we see, the proximate causes in terms of impacts on humans, modifying factors, and then the health impacts. So kind of you can trace your way along and see the way in which different environmental changes might affect different communities in different ways as it pertains to health, whether that's nutritional diseases, ID, non-communicable disease, direct injuries, child and reproductive health, or mental health. So the landscape at Johns Hopkins, we have a planetary health interest group at the medical school, which is what I'll be talking about mostly. So this is just an overview. We have a selective that I'll discuss. It's a course that I'll be running in November. We also have a collaboration with a few local organizations, and then a few other things that we are up to there. There's also the Institute for Planetary Health. So this was created last year by the folks that run the Planetary Health Alliance. So the Planetary Health Alliance moved from Harvard to Hopkins in 2023 in the summer. And they created this institute in 2024, which looks at curriculum integration at the School of Medicine, as well as then works with every different school at Hopkins to kind of connect the dots, thinking about this being a transdisciplinary space, how we can engage the students at the engineering school or the School of Nursing or the School of Public Health, and kind of trying to create a wider net. So I'm happy to talk about the Institute later. I'll be focusing just on what's going on at the medical school and giving a little bit of a highlight reel. So first, to discuss the Planetary Health Selective. So we have a course that runs throughout the first year for medical students. It's called the Foundations in Public Health, Epidemiology, Ethics, and Healthcare Systems. So this is a course that basically there are 3 different components to it that you can see here.
But one of the great things about it is that students are able to opt in to 2 different selectives. So it's a 3-week course that they'll sit in and they get to choose whatever their topic is. So we have anything ranging from a selective on mass incarceration to this planetary health selective. So in terms of the formatting of it, since I only have 3 sessions to talk with these students, first, we're going to have a background to planetary health that will be presented by Chris Lemon. Dr. Lemon's an emergency med physician and the director of the clinical programs at the Institute for Planetary Health at Hopkins. And then we're going to have a panel discussion. So guest speakers are going to be a former Maryland state delegate, the director of Chesapeake Physicians for Social Responsibility, and then the director of environmental sustainability for the Johns Hopkins Medical Institution, Department of Anesthesia and Critical Care Medicine. As well as then the Planetary Health Fellow in the EM department at Hopkins, which is a new fellowship that they started this year. So that's going to be a conversation about different interdisciplinary pathways to get involved in the climate and health and planetary health space in Maryland. So whether that's through policy, whether that's through organizing, which you see more often with CPSR, or through the kind of sustainability side of the health system itself. So these are the objectives for the course, which I'll just leave there. I'm also happy to send the syllabus to anyone who might be interested. I'm really excited to offer it to the students. Next, we're having an event that's environment and health history taking. So this is a 1-hour guided interview taking session with the clinical staff affiliated with the Institute. So the goals of this are basically to recognize common environment and occupational exposures that can impact health across different patient populations, to actually integrate targeted environment-specific questions into routine clinical histories, and then to apply that kind of process into case-based scenarios with people that will be acting as patients. So this will be something that we'll offer to the entire School of Medicine community that we're really excited to kind of get in more of an informal event space. At Hopkins, students don't really go to casual events very often, so they kind of have to have more of a clinical bend, which is the intent of this. And I'd also, this is just an aside, this is an art project that some of my classmates and I worked on. I don't have a slide about sustainability at Hopkins in this presentation, but this was basically made of medical waste that we got from the cardiac ICU, cardiothoracic surgery, as well as then the OB-GYN department. Basically waste that they were getting rid of, or supplies that were expired, or things that patients didn't use. And we created this 3-dimensional heart. So it was a fun thing to do, and I like to show it off whenever I can. If I had thought ahead, I would have brought it here today. Just because it's a fun project that got us kind of nice and distracted away from our pulmonology studying. In terms of the health system, I'll just take a second here to say, since we see this like sustainability related art piece, that we have some really great advocates for change at the health systems level at Hopkins. So one of them is the anesthesia and critical care physician that I mentioned, Nick DeLessio. He has worked very hard to get desflurane removed from the hospital system, which has been fantastic. And he also has been doing waste audits, and they're running a reusable laryngoscope program as well. So there are pathways for funding for kind of projects like that at the institution. We also have a sustainability leadership council that people across the institution sit on. So I sit on it, as well as a few physicians. There's also a hospital system specific leadership council. And we also have composting and recycling bins at the medical school, as well as then at the School of Nursing, the School of Public Health. And I know we have recycling bins in the hospital. I believe some area, there might be 1 or 2 compost bins in like the dining area. If I had thought as well, I would have included the selfie of the Planetary Health Interest Group when we got our composting bins in the school, because we were very excited. So then in terms of the Planetary Health Report Card, we've gotten to discuss that a little already. So this is our change in time at Hopkins in terms of what we're seeing our scores at. So we were at a B this year. So you can see, I didn't really go into as much depth as my colleagues at UVA here, but I'm happy to talk about each of these areas and why we sit where we do. But this is our 2024-25, so you can see a bit of change over time. Generally, things are getting better, which also correlates to the founding of the Institute and pathways through them.
Next, I want to talk about curriculum integration. So this is one of the main things that I'm working with the Institute on at the School of Medicine. So in terms of the formatting of the school, we started in Genes to Society, which is the term for our preclinical curriculum. They just condensed that from like 1.75 years to a year and a half. So I used to start on the wards in March, and now I will in January, which means that they took everything and they just squished it. So curriculum integration at the preclinical level has been a challenge because most courses have lost 1 or 2 days. And so it's already drinking from a fire hose. Now you're drinking from a fire hose that's just like slightly turned on more. Then there's transition to the wards. It's a month-long course between preclinical and the start of clerkship that gives you a lot of practical training to start on the wards. And then finally, the clinical years. So in terms of what we're doing at each of those phases, in Genes to Society, for this coming year, we've incorporated planetary health into the epidemiology course, as well as then the microbiology and infectious disease course. So I mentioned in the epidemiology course, the selective that I'm offering. However, there's also case studies during the specific epidemiology component. So we have a flipped classroom and it's case-based learning. So at the EPI program, what that means is they have a few different case studies to learn fundamentals of EPI. And I've rewrote them with the course director to have them be like climate focused scenarios. So whether that's infection control or natural disasters or climate related, that's what the formatting has been. And then the microbiology and infectious disease course, people don't watch the lectures as often at Hopkins. They tend to veer towards third party. So rather than incorporating planetary health into the lectures, again, the approach has been to put it into the case-based discussions that students go to every day. That's also getting everyone to think about it a little more rather than just listening to it, which is another great approach. It's kind of as multifaceted as we can be. That would be fantastic. As well as then we're working with the Office of Curriculum to get this into place. For transition to the wards, lovingly known as TTW, the Director of Clinical Programs at the Institute is working on getting planetary health embedded here. As you can imagine, this is a course that's taught largely by emergency medicine physicians, and that tends to be one of the most sympathetic departments at the health institution to this concept. So I can't speak to exactly what Chris is working on there, but I know that it will be in my class's version of TTW when we go through it in December, and I'm excited about that. And then finally, because of the time that was freed up in the Genes to Society curriculum, we now are reimagining the 4th year at Hopkins. And so whether that takes the form of a planetary health elective or some sort of different format is still TBD, as there is a panel. All of these institutions, it's just like, this is our committee on this is our committee on that. I'm on the committee now to decide if we go into graded clerkships or not. So it's a committee for the 4th year, and that's something that's coming down the pike. We also collaborate with local organizations. We've mentioned multiple times in this conversation, thinking about patients and how you actually engage patients. And so that's taken kind of more of a form with our work with this group called Medicine for the Greater Good. So it's a initiative that's initially run through Bayview Hospital. So there are multiple different Hopkins hospitals. That is just one of them. By a physician named Panagis Galliastatos. And so Dr. Galliastatos works with the community, whether that's through faith-based organizations or schools, to get involved and discuss kind of whatever they want to do in the realm of health promotion. So they also have a CHW training program that I work with quite extensively. Oftentimes it's led by those community partners, what we're actually working on. So some feedback we've gotten from community partners is that they really want to have greenhouses at schools. So we got a small seed of funding to build 5 greenhouses at 5 different Baltimore City public schools that we're really excited about, that we're in the process of getting all the permitting and everything. You mentioned the challenge with the garden at the school. BCPS is no exception. And then another initiative we have is we create DIY air filters. So we have workshops with local students as well as then with churches throughout Baltimore, recognizing that air pollution is a major concern in Baltimore, especially in the Curtis Bay area where we have a very large medical waste incinerator. This is one of the ways that we like to help out from more of a grassroots ground level. And this is something that the community members were thrilled about. They sold them at the school auction last year, and people were like fighting each other left and right to get them. I was talking with one of the teachers who built that program, and she just sang its praises. And there are also research pathways for students involved with Medicine for the Greater Good and community-based participatory research. And then at more of an advocacy level, we work closely with Chesapeake Physicians for Social Responsibility. So students write legislative testimony during the Maryland State Assembly and also get to engage with other Maryland's medical schools this way. And this coming year, we're going to have a formal testimony writing workshop for the 2026 legislative session. So that is planetary health at Hopkins. Just a little bit of a smattering. Happy to talk about any more specifics, but I wanted to thank VCCA as well as then all the folks at Hopkins who made this possible.
Or some questions from the audience?
Yes. Thanks for sharing all of that. I think it's really awesome to see like all the work that you've done there and are continuing. And I think what you were talking about with the case-based learning and like working that and integrating that into the curriculum is like such an amazing feat. I'm very curious. I feel like a lot of the all the students that have spoken like have shared similar things of the barriers with the student body, rather like not necessarily being resistant to learning about this, but more just with their time and with like balancing that. And so I'm curious, like in those sessions, like what is the receptivity of your students, and have people embraced that? Has that led to discussion? Is it kind of just taking it at face value and then just kind of getting to the underlying question that's being asked and kind of glossing over that? Yeah, I'm just curious what that's been like.
Yeah, thank you for asking, and that's a great question. I think generally I can't speak to actually how these will be received because we haven't ran the courses yet for this coming year. But generally what I've found to be true in the context of these clinical scenario workshops is that this is really the only time that students get to ask questions about the material outside of review sessions or emailing a professor per se. And it's small groups, so it's about like 5 or 6 students each working on a question. Folks get really excited about it as long as it's after 10 a.m. So I think a question that I've had relating to that is as I rewrite these questions, I want to make sure that it's received well and that there's some sort of fundamental learning occurring, and you can't just like skip the question stem that has all the climate specific, like, the meat of that, and then just answer a question about like Coxie in the Southwest or something like that. So that's something I've been keeping top of mind. I think that it comes down to kind of asking questions throughout, or sometimes we'll have students research something, like to just look something up while they're working. So if you had a question that's like, okay, well, why is it that we're seeing an increase in Coxie? Or like, how does Coxie relate to dust storms, thinking about Arizona? And like, how does valley fever change over the past few years relating to this increase in dust storms? So whether it's something like that, or like that's the micro ID level, the infection control is a little bit easier just because this work oftentimes falls in the public health or epi space. And so it's easier to write questions that actually get to the heart of that. But yeah, that's a good question. And that's something I'm hoping will be well received.
Other questions? So we've been hearing from a lot of schools about all the great work that you guys are doing. And just as a reminder, always make sure your CV is updated as a scholarly project. And even attending an event like this is considered a regional campus, the regional conference where we're really coming together from the state of Virginia and surrounding areas to just hear about the subject. I know we didn't go a lot into the actual material itself today because it's more about while we do know there's a lot of education needed about how climate change relates to health, whether it comes to infectious disease, pulmonology, cardiology, as you guys have all alluded to. A lot of this is about curriculum integration and doing the great work that we do to educate the next generation of health professionals. Now, I will say that the next presentation we're going to be really excited to hear about. The presentation is not so much about curriculum integration in medical health professional education, but it comes back a little bit more about the actual research that is done when it comes to really helping us understand the magnitude of what's going on. And I remember in the first and early days of this space, it really impressed upon me is that a lot of the lectures, the the folks that are knowledgeable about the subjects are our PhD colleagues who have done genuine firsthand research and have been seeing these impacts where are able to translate these knowledge into patient care. So I do want to bring up Sharon Shan from very own George Mason University here. She's going to talk to us about her work and in terms of air pollution, health impacts, and climate equity. So.
Hello everyone. Thank you for having me. So my name is Sharon Shan. I also go by Sherry. I am a last year PhD here at George Mason. So I think I'm the only engineer in this room. So I'm I started environmental engineering program since bachelor. So this year is going to be my 12 years for doing research in environmental engineering and health. So I think I'm just really excited and here today to present my research. So let's go. So before I present my research, let's go a little bit about my background. So I was born in China in an industrial city. So I remember when I was a kid, I had really bad allergy. My mom has to take me to the hospital to do weekly treatment. But nothing get better. So in 2014 I went to Hohai University. I did my bachelor in environmental science of engineering. So I study a little bit about wastewater treatment, water quality, and general classes about environment. And then something changed in 2017. I got an opportunity to do my master in France. And I really remember the first day when I arrived in France, all my allergy has disappeared. And that's the moment I realized, oh, actually environment, it's really important, and especially air quality, because when I was in China, I breathe air quality there every day, but I didn't realize that make a big impact on my health. So in this French college, I studied a master in environmental engineering, and that's the moment I learned how to do research about air quality and health. And then in 2019, because I finished my degree in France, I don't know what I want to do. So I went back to China. I continue another master in my university. And then COVID happened. I stayed home for half year. And that's the time that's the moment when I really got time to think about what I want to do next. I think because my allergy came back, so I think I want to do some research about environment. I really want to benefit human. So well, I don't know if I can say this, but thanks to COVID, I had time to prepare my application and then apply to the United States, and I got a PhD offer here. So I came here in 2021, and now it's been my first year. I'm going to graduate soon. So my research interest. So at George Mason, I use lots of air quality modelings. I do lots of health assessments, and also environmental justice. I will explain more here. So my current research and skills. First, source specific air pollution. What does that mean? We all know we have lots of different air pollution, air parcels in atmosphere, and they are all from different sources power plants, vehicles, wildfires, and residential commercial coal combustion. Those are the major sources who contributes the most air pollution to the atmosphere. And my research is to use different air modelings to quantify exposure when there is no measurement exists. For example, even back to 20th century, we don't have like, and we like EPA was established in 1970, so there's no measurement in 1940. So for studying the air quality at that time, we need to use air modeling. And then I have like, I work with lots of like collaborators from different universities. They are all epidemiologists, so they have like lots of health data, and I link my air exposure to those like health data to study about the impact on public health and also like the Medicare, the mortality and the healthcare costs for those environment. And then I also study how like environmental regulation impact about the climate change and also the environment. So my routine, like I like, so this is my like office. I come here weekly during weekday, and I need to open. So the first thing I arrive in my lab, I will open my computer. I will run a large scale of air modelings to on my supercomputer to capture like the emissions and exposure changes over different time and region. And then once I have like those data set, I need to like use different program to visualize those data. I need to present my research to the general public to let people understand what I'm doing. And then I also like, and then I provide those products to my collaborators, and they can link with their health data to do more like health analysis. And also with like everything, I will look into like the policy, how those things affect like environment, affect like human health. So why the question is like, why does my research matter? So like from this image, you can see when so when people inhale, when human inhale air pollution into their body, those particle can go really deeper in into different like parts of our body, and might cause like different disease in like lung, heart, or even like brain. So like, and if you are exposed in a long time of some region, you can get like a accumulate impact. So our research partner believe that like long-term exposure can cause like public health impact and possibly like for Alzheimer's. So our research question are: first, does air pollution increase Alzheimer's risk as like an environmental factor? And second, if yes, which source matter the most? And which pollutant cause this impact? So that's my kind of my research motivation. And then like so I think I remember from like this morning's presentation, someone said like people don't really understand what is like emissions and exposure. So like before I go into my go into detail, let me explain emissions and exposure. So like emission is like the amount of pollutant released into the atmosphere, and exposure is the amount of pollutant you like inhale into your body. Like imagine you are cooking in your kitchen, so like your stove, so like there are like certain part of smoke release from your pan, and that's called like emission. And since you are cooking, like you breathe them in, and those particles goes into your body, and which can cause like human health impact, and those are like exposure. So like this table listed like major pollutant sources which contribute around like 60 to 70% of air pollution from anthropogenic activities to the atmosphere. And there are some like major health related pollutants like listed here. So different pollutants can cause like different health impact, and also there's like amount of like percentage from like each sources. And so like these like first sources are the major sources I look into from 1914 to like 2020, and I use like different air modelings and methods to quantify their exposure emissions and exposures from the historical time to the present. And then today I will just give you overview about like one of the sources, like the power plant. So that's like example of my research results. So like now our question is like how we can quantify the emission and exposures from power plant back to 1940. So first we can start with like the power plant data we have. So like from like the EIA power plant form and from like the EPA power plant form, we can find those historical facility back to 1914, and we can find some information like their capacity, their locations, like different fuel type like coal, oil, gas, etc. And then once we have one facilities information, we can we use like emission factors to multiple to this like facility to estimate how much like different pollutants emissions was emitted to the atmosphere. And then once we have this emission, we can add like different weather parameters like temperature, wind directions, humidity in 1914 in our model. And then we can run this model, we can get like the concentration. And we reply these steps like multiple times for different facilities. So from 1940, we have in the United States, in 1940, we have like less than 3,000 fossil fuel power plant facilities. Until like 2010, we have like over 30,000 fossil fuel facilities. And here like is like the exposure figures like spatial exposure result about like the PM 2.5 around the United States. So from this figure, you guys can see like so like the 1941, the like yellow part present the most highest concentration, and also like the 2010, the like the yellow one present the most highest power plant concentration, PM 2.5 concentration. So you can see like from 1940 to 2010, like this this higher concentration region shifted like due to the facility location changes, the like the different environmental policies, and lots of like factors that we can study. And with this exposure map, we can link it to like the population census check, and to study further about like health impact. So find out why the like the my research matters for the future, because you know like for people who were born in 1940 and who still like live in 2010 when they turn into 70 years old, even though they might have lived in a better environment condition in 2010, it doesn't necessarily mean like they can get like a high risk for from Alzheimer, maybe because they were exposed in historical time. This study will help like to support like different society like NIH, EPA policymakers to make sure they adjust like the environmental standard and we live in a better environment condition. And also the better quality policy will protect human, so you know they can reduce like the cost from the health, and they can have more like climate action strategies. So like my research is from like emission, like the amount of pollutant in atmosphere to exposure, like the amount of pollutant in human body, like to the health problem, and how that will make cost to human and make policy to have an action. And take away from my presentation today, so air pollution is not a thing because like we have so many different sources, and different sources can cause like different disease, and historic still affect today's health. So like even we have like a better environment today, we still need to study like the historical environment impact to like have like a better policy, better action for the future. And science can get like a fair policy. So like that's why it's important for us to do like the data analysis. We can present our resource study to turn like this into action. Thank you if you have any questions.
Very well. Thank you so much, Sharon. I would say, I think the one thing that strikes me the most is that map that you see and how much has changed between 1940 and 2010. And I remember that kind of reading about the Donora smog event, and this is a historical event that happened in the borough of Pennsylvania, and that Pennsylvania as a state was actually kind of right in that yellow region, and this was a environmental catastrophe that really spurred a lot of the early actions when it comes to environmental legislation. So this is a perfect example of, as Xiaolu, you have said, basic science, which is important, that turns into public policy that affects human health. And that's the reason why we're doing all of this. So
I know we're sort of running out of time, but thank you for your talk. And I just wanted to give an example of what about 5 years ago in 2020, VCCA commissioned a study talking about what would happen if Virginia took over the Clean Car Act of California. And we sort of saw that it helped asthma, cardiovascular disease, and saved money. And we presented that research to the legislature, and eventually Virginia adopted the clean car standards of California. But one of the things that I love to hear about is you mentioned Alzheimer's, which has more emotional resonance for many people than does sort of asthma attacks. And I would love to hear if you found that same data and that you can use your studies to sort of present future actions to improve health going forward and policy.
Is that a question?
Yeah, so like thank you for your question first. Like I started this research since 2022, and now I think this work is almost done. So like we published some papers with my collaborators. Some manuscript I am like under review for certain journal, and some part of manuscript are still like in writing. I think like one of the interesting things like I found in US like is that because you know, China, it's not like a immigration country. So our residents are like they are all like most original from China, like they're all Chinese. But in the United States, we have like different racial people, and from our study, like we found that like in the historical time, like the different races, they can different races, they locate like in like different area. Like for example, for those low income people, they are often like Black people or Hispanic people, and because those people, they are like the original immigrants from to the United States, so they just do like low income jobs, so they stay in the domains where like it's cheaper, so it's it's more polluted with like industry factories surrounded. And for like for upper class people, like the white people, you know, they are well educated, especially like in New York, they are well educated, so they earn more money, so they like even like in the like in new big city like New York, this like more polluted city, they live in like an area where it's like you know, have a better environment, less polluted. So like our study just showed that those people have like less risk exposed in the air pollution, and they also have like less risk to have Alzheimer's. So that's we also have lots of like interesting findings. So yeah, through our publications.
Oh, stay tuned. I think in the interest of time, we'll, you know, of course, Sherry will be around to answer additional questions about the research, but I would just emphasize that this, you know, aside from genetic factors, the environmental factor is huge, and this concept of zip code destiny, and the concept of just environmental injustice runs very deep. And I think this is present in all the work that we are doing and the research that we're seeing. So thank you so much. All right. So, you know, I'd said before, we in the past we have introduced a worksheet, and I would just take the 2 minutes to pull that up and, you know, really kind of just showed what it looks like. So this is a worksheet that we developed a few years ago. I think as somebody had mentioned, you know, that it would be nice to have a roadmap to see where we go from point A to point B. This is one tool that you can use to look at the current state of climate and health education at your school and program. Think about the logical next steps. And then look at who the stakeholders may be, and in doing that research, have a document to then list the materials and looking at where the curriculum and objectives are, include information about the curriculum calendar, and have an action item in this upcoming year. So we are here to, as a resource and as a collaborative, to help everybody just fill out and complete one of these forms for your own institution. And, you know, Nick, I and Beth will be happy to review that with you so that we have some concrete goals that we can accomplish in the next year. So this form is available. And of course, Nick is reminding me to share that we will be putting all the materials onto our website, including the recording. So all the slides and PDF forms, along with live links to the different presentations, are all going to be there. So as we get our, actually 1 second, hit the slide. So I do want to take a moment to introduce Dr. Abigail Hankin-Wai. She's the chair of VCCA. We want to, you know, have you guys get involved with VCCA as an organization, and our mission is to educate and mobilize clinician leaders to bring the health voice to climate solutions in Virginia. So as educate being the first verb. In this mission, we feel like our committee is very important, but I want to have Abigail kind of share a couple of words in terms of why she thinks education is important and why this conference is impactful in her mind.
Thank you. Thank you all. And I think it's been fantastic to see that we have a range of speakers from different aspects of the educational landscape and different professional roles. How many minutes do you want me to take? I can talk forever about why this committee is so important. A couple decades ago, I was a medical student at UC San Francisco and part of our Healthcare Without Harm chapter. And that was my first connection to the space between the bilateral arrow between healthcare and climate change, and our responsibility in both sides of that arrow. And I was very engaged with that part of our university landscape and ended up then you'd go on to residency and then perhaps new attending jobs and starting a family. And I will tell you, I ended up engaged in other aspects of public health and engagement as an educator, but I put aside the climate and health piece. And the spot that brought me back are number one, Dr. Y, and conversations with him in which I said, I'm really interested in getting back into being engaged in climate and health and what could I do? And so just engagement with an educator in this space already brought me as another physician in the health system back into climate activism. And then the other piece that brought me here, and is why I'm here right now, is that I have kids and I have a daughter who came home from 5th grade one day and said, I'm really worried that the planet won't be healthy when I'm an adult. And when you have kids, you go through the phases when they're worried about things that don't exist. And then they worry about the things you can protect them from. And then they worry about the things you also worry about. And that was my first moment of this third phase. And the only answer I had for her was, I'm going to do everything I can to keep you safe. So I just want to say to you guys who are in this moment right now, number one, the work you're doing in the climate and education space, you may not know the ripple effect, right? Somebody may be a decade from now, more than a decade from now, engaging in climate and health advocacy because you are there pushing it for right now. You don't know the conversations that they bring home, right? That are going to change the life of somebody adjacent to that person. And then the last thing I want to say is, I am here for each of you. We need to carry each other. I actually pulled that same daughter into the recent testimony for the EPA change of the endangerment finding. And we had 2.5 minutes and we gave that 2.5 minute testimony together. And she said afterwards, is it really going to change what they're going to do that we all gave these testimonies? And the truth of the matter, I'm going to be honest with you guys, I think it's unlikely it's going to change. But, and I said to her, we were there talking for everyone else who was there giving testimony, and they were there giving testimony also for us. And so my message I want to give to educators and the students is we are VCCA are here to carry each other. And if at some point you feel like you need a break or you need a pep talk or you need someone to carry for a while, come to me and we'll carry each other. And thank you for being here. Thank you, Homan and Nick. Oh, right, fundraiser. Thank you, Homan and Nick. Thank you for everyone who's taking time out of a valuable weekend to be here. And yes, so our last spring fundraiser was dedicated to making sure this conference happened. And we have a new fundraiser that I do want to kind of distribute pages about. We're working on finalizing speakers, but we're focusing it on health professionals who in the audience who are not very familiar with these overlaps, and also lay members of the community who really want to learn where are the links? How is climate change going to affect my body or my child or my cognitive future? Please spread the word. We'll be communicating with you by via our newsletter and other forums to try to get people to spread the word. And we're looking for sponsors. So if you have a business you frequent or anything like that, I have also a sheet to distribute to potential sponsors. Thank you.
The fundraiser is in October.
Yes, October 25th.
Obviously.
Also the sponsor.
And financially struggling health professional students, we totally understand. But spread the word. This is all about kind of spreading the word in our mission, and we do really just want a broad engagement across the Commonwealth. All right. So I have been informed the food's actually going to come in closer to 1 o'clock. So there's still a little bit of food for breakfast if you're starving. We can have you guys take a few minutes of break before we introduce our keynote speaker, Dr. John Balbus. So why don't we have you guys come back, if at all possible, by 12:10, just a quick break, and then we'll kind of get back on the programming.
Yeah.
Thanks for being here. Yeah, no, the parking lot. But dude, every time I come here.
Always for the medical society. Always blocking.
The cameras will focus on whoever.
Can't wait. I saw that.
Like things that just.
Recyclable, I think.
It's a question for me, or why don't you guys chat? Yeah, absolutely. Why don't you guys chat? And then we'll
I mean, a little bit of circling. I had no idea where I come out. Yeah, like, I'm not sure I can retrace the steps. So it's a little bit.
I thought I knew my way on something there was.
Yeah, I know.
Exactly,
You hear
exactly.
something,
They're all- Alleyways back there.
For the
All the same.
But somehow last year.
That's okay.
Better if I just come here straight.
This will focus on education.
Think about it. On some weird roads, but.
Yeah, like manufacturers, yeah.
Very safe, yeah. Early.
There's some very good.
We were identified as the first to go.
I think that also, the consortium event is already kind of jam-packed, you know? We do have like sessions.
Because
That's
what I thought.
But it's not as, it's not like a. I was thinking that this is like.
Right.
So. That's interesting.
This is.
That's so.
We try to.
And I think we usually have a person.
I really, yeah, my go to.
Yes.
There is one.
So anyway, so you.
And then I got dog.
That's just really.
You're not, yeah.
Yeah. So
Two different things.
But.
Like,
So. So I retired in February. Hear about it?
It should be.
So I really find ways to continue to support
Getting, yeah, all the like wireless.
Literally
kind of
at least if they're.
Yes. Not yet, most like.
I just got this.
30 years of my life.
But
And I guess we can like.
we were ready to be leaders.
Yeah,
I know, that's how I.
So I'm.
Very fortunate. One thing that I know, like, given how their places specifically on like issues that we. Yeah, except that's why I was adamant about the studies, because that's actually phrased in my education. Yeah. I love like, you know, with the rash and you see the physical rash. And now I like right here, you know, like right in the middle.
All right. Welcome back, everyone. So we are really excited to have a very special speaker that I would like to introduce. So Dr. John Balbus, I'm going to cheat on my note here so I don't get anything wrong. Dr. Balbus, he's a principal of Climate Care Consulting, LLC, and former HHS Deputy Assistant Secretary for the Climate Change and Health Equity. He was trained as a physician in both internal medicine and occupational environmental medicine. He has devoted his professional career to the understanding of and addressing of health implications of climate change. He established and directed the HHS Office of Climate Change and Health Equity while serving 12 years, after serving 12 years as a senior advisor for public health at the National Institute of Environmental Health Sciences. Our positions include serving as a chief health scientist at the Environmental Defense Fund, as associate professor and founding acting chairman of the Department of Environmental and Occupational Health at the George Washington University School of Public Health and Health Services. He received his undergraduate degree in biochemistry from Harvard University, his MD degree from the University of Pennsylvania, and his MPH from the Johns Hopkins School of Hygiene and Public Health. He was elected to the National Academy of Medicine in 2021. So Dr. Balbus is going to talk to us about healing in a warming world, what climate smart doctors can do. Thank you very much, John.
Thanks so much, Owen. Hi, everybody. So I don't know if I'm glad or sad that lunch isn't on the table. You know, I think, you know, hopefully nobody's really hungry. Nobody, you know, if you're feeling like you got to pass out or something, please, you know, raise your hand and get a bagel or something like that. I'm really excited to be here today, and I really appreciate coming after Abigail's comments, and I'm going to start just reflecting a little of those. This geography has an interesting meaning to me because one of the reasons I started on my medical journey was a chance encounter. And those of you who've heard me talk, I've said this before, so sorry if I'm boring you, but I had this chance encounter with Patch Adams, who later wrote a book, had a movie written about him. And he came when I was a first-year medical student at Penn to a bunch of kind of crazy thinkers group and said, you can live your medical dream. And at the time, he's had one medical dream his entire life, which was to create a free clinic, in a rural place where patients, mostly mental health patients, could come and live with their providers and pay nothing and just get cured in a kind of naturalistic environment. And the reason it's special here is because he lived like 2 miles away from here. And from Philadelphia, and I corresponded with him. He was an incredible letter writer. He spent hours every night writing letters. He actually returned my letters, and I ended up spending some time with him. But his point was that being a physician in this country is an incredibly privileged position from all kinds of ways, from a societal way, but also from a financial way, and that, you can work a crazy short amount of time every month and support yourself better, at least at the medium income, if not higher. And so you don't need to buy into the orthodoxy that you need to be a, killing yourself 5-day-a-week clinician to be a good doctor or to do well in the world, that there are many, many pathways open to you and that open up to you as a physician. So just like to remind myself of that as I come in here. It was very influential in my life. Let's see if this works. Does this work?
I don't think we've.
Let's see if that works.
Go ahead and.
All right, that works. Nope, but that's not my slideshow.
Oh.
So.
Oh, well, that can be fixed.
There we go. So, do I need the microphone? I don't think so. It's a small room.
As long as you're close enough to.
Am I recording?
Recording and also online audience.
Oh, sorry, online audience. Back to the microphone.
But close enough is fine.
So I gave this the title Healing in a Warming World, and I also want to pick up on what Abigail was saying there. That word healing is incredibly important because, first of all, it's why we're all in the room. Everybody in this room is here because they have a personal healing mission of some kind. And that is what motivates us, and that's what brings us here to be thinking about how do we take that healing mission and extend it out beyond the narrow confines of medical practice, which is pretty big, but we're talking about even breaking those bonds. But it's also about healing the planet. I have a Jewish background, and there's a part of the Jewish faith called Tikkun Olam, which is healing the world, which is kind of a central core. And I think everybody who ends up as a physician and a people healer who gets involved in environmental health and climate change also shares that kind of how do we heal this planet that we see suffering. We see animal suffering, we see plant suffering. We know that the non-human environment is suffering too, and we want to heal that. And then the last is this point of healing ourselves. And I don't want to start talking without acknowledging that these are incredibly traumatic times for people who care about these issues. I was traumatized yesterday. Like I'm a pretty resilient person. I've been doing this for a long time. I like to say I have like an inch of callus on my forehead. But yesterday was a really, really hard day when they announced they're taking down the GGR, the Greenhouse Gas Reporting Program, which is kind of fundamental, and it's fundamental to all action, and especially healthcare action. So this idea that we are in hard times and we can't suppress it completely. We're all suppressing it to be here today and not being in a dark room somewhere, but also that we hold each other up and we heal each other and we acknowledge it and we support each other and we celebrate each other in the way that you were talking, how everybody that got up at the endangerment finding hearing was a celebration there and a kinship, and almost everybody. And we need to see that and feel that in what we do as well. So with that, let me launch on in. There's limited amount of time. I'm going to really try to focus on three things. Actually, before I do that, it's a little bit of a mixed audience. So I just want to see how many people here are actually medical students. Good, that's a lot of you. And how many of you have ever been a medical student yourself? Okay. And how many of you know a medical student or someone who has ever been a medical student? Good. So everybody needs to be in this room. Everybody's got the creds. Okay. I'm going to, I have these, these are my goals for what we're going to talk about for the next half an hour or so. First is to acknowledge the importance in what we're doing of the health sector. And we're just going to touch a little piece of that today, which is the vulnerability of the health sector. The impacts on health systems are something that haven't been thought about quite as much. We usually think of the public health perspective, the NCA chapters, it's all about the public health, the impacts on humans, but the impacts on systems are really important too. And we need to be the experts on that. And we need to shore up our systems and think about the resilience of our systems wherever we are. We have a really important role to play there. The second is, especially in these times, like we're not going to survive on the hill in the battlefield to save my office. I mean, that's long gone. To save things with climate change in their title, to save things with health equity in the title. We're not going to win that battle in the short term, although there are places where things are happening. So what I want to submit to you is that as clinicians, as physicians, as health providers, it is just as important to weigh in on the mainstream battle to protect social services and social safety nets, because that is how we're actually going to save lives. We're not going to save doctors know how to treat heat-related illness, so we can learn a little bit better how to do that. We know how to treat dengue when it comes up. Okay, so we have to make sure if we're in the southern tier of states that we're looking for dengue. That's not going to be the big thing. The big thing is going to be doing everything we can at the federal, congressional, state, local, and health system level to ensure that the most vulnerable in our communities are not energy secure, are not food insecure, to the extent we can, are not economically insecure, because that creates incredible stress. And those are the vulnerability factors that we can do something about as clinicians if we are educated in social services, in the human services side of thing. And that's where we have to, that's the battle I think that we need to really be focusing on in these times, as all of those things are threatened as well. And last point is you're hearing it already, that yes, we're going to fight on the federal side, but there's a lot of progress, there's a lot of value and a lot to be gained at the subnational level, state, territorial, tribal, local, and in our own institutions, private sector, meaning our hospitals, our medical schools, as well as philanthropies. So this is my favorite big overview, everything on its slide. I don't know how many of you use this. And there's a couple reasons why I like it. One is it does put, it kind of captures the essence of the diagram that we made in the climate health assessment in 2016 that shows that pathway between climate hazards and health outcomes is very much affected by environmental factors and social factors. And so we'll come back there. It's a little bit funky because, it talks about exposure and then it lists all these systems. And, we can debate what that means. When I look at those systems, I'm thinking, people have to have access to fresh water, they have to have energy security, they have to have nutritious food as vulnerability factors. But anyway, that's up at the top. And then it's that bottom right corner that I also like about this, which is that our health systems are not just impacted by people showing up in the emergency room during a heat wave. They're directly impacted by the floods. They're directly impacted by the wildfire smoke. Oh, and there's that little smokestack there. They're also polluters. And, there's a role for us to actually do solution to the overlying problem, not just the adaptation and protection side, but also to be working on the sustainability side. So that's all I'm going to say about that for the short term. Happy to think about questions of all the things I'm skipping over. I'm happy to go into things in more detail. But I want to get through this, and I actually have a little exercise we're going to do together. I tried to find a good overarching, I'm kind of a framework geek, so I was looking for good kind of everything on one slide description of how the core social determinants of health are actually almost identical to the core vulnerability factors for climate change. And so if you care about social determinants of health and do something about them, anyway, I'm sorry, if you care about social determinants of health and you care about climate change, call it social determinants of health or call it whatever term it is right now that's so mainstream in healthcare. It actually was, it added a good 1/10 of an inch of callus to my forehead working on this. In HHS, we had a hell of a time working with the White House committee that was working on social determinants of health to even get climate change mentioned as a context, let alone thinking about climate change as a social determinant of health, which people talk about. Tremendous resistance. And you'll see that, this has been the history of social determinants of health. They'll always say there's 7 social determinants of health or 6 or whatever number, and one of them is always environmental exposures. It's always in there. So, air pollution, built environment, all these things are in there. And then when they get to what are we going to do, it's gone. It's gun violence, domestic violence, it's nutrition, housing security, and the environment just disappears. And that is a challenge we have in this space, is that health people don't like to think that they have anything to do about environment. That's the environment people. Those are the engineers, right? We need engineers to fix that. We need doctors that we don't do that. So anyway, I found this, which was an interesting study, and it was a paper all about, it came from Europe, so the language is a little bit different, but it was all about, the existing social protection functions and how they may be rethought of or integrated into thinking about climate resilience. And so you can see, there's all those things in the middle that we have programs to do. We have LIHEAP, the Low Income Housing Home Energy Assistance Program. We have SNAP. We have HUD grants. we used to have FEMA resilience grants, and some of those are still going. And they're not climate change grants, right? They are the social safety net. And so it's there. There are defenders of it. They have always been bipartisan. I mean, it's only this crazy world we're in now where they're under attack by, with nothing behind it, with no vision or idea or policy behind it, just like tear it down. I'm optimistic that there will be some saner heads prevailing for many of those things. Anyway, enough said. Think about that. As you go out into the clinics, as you hear your colleagues talking about, all right, how are we have this patient in the emergency room, they don't have a cool space to go back to, within OCHI, and I didn't put this in any of the slides, we created a referral guide for clinicians that kind of lays out the spectrum of places you can refer patients to, because how many medical students get trained in how to connect people to LIHEAP or program? Like I know, I mean, 40 years ago, nobody did. Anybody get that in like, even a sub-I or, well, don't tell me. No, tell me about it.
So we have a few different courses between our clinical blocks that talk about health equity or social determinants of health or nutrition. For example, they taught us about how to connect folks with SNAP and WIC and other similar programs to that.
That's totally awesome. That's totally awesome. Is that at Hopkins? Is that where you are, Ursula? Yeah. Well, scale that because we really need that. We really need that. This is an image that I stole a few years ago from the social determinants people. I can't remember exactly where it came from, but it was an HHS. And this has nothing to do with climate change, even though it kind of looks like a stream, that may be drying up. No, this is not a climate change slide. This is just a straight social determinant slide. And, I think it's just an important way to think about it. We have public health is addressing kind of the far upstream, that's their vision. And healthcare, we know, is completely downstream. And most of us who are in this space lament the downstreamness of healthcare. I know as a medical student, this is what got me on the path with Patch Adams, was a sense that, there's the whole metaphor of, the babies coming down the river and, you got to go up to where the person's throwing them in the river, that kind of thing. I just felt it was so downstream and I wanted to be fighting upstream. And, my upstream was like policy and other sectors, but it's the midstream that we have to be thinking about and protecting. It's the enormous infrastructure, the enormous number of people, enormous number of organizations. It's like a whole field as big as medicine, the human services. This was something that was a big learning curve for me when I went from working at, NIH to working for the Department of Health and, what were those words again? Human services. I knew nothing about human services when I got there. And I was really amazed at the number of dollars flowing, the number, 30,000 organizations providing this across, the 3,000 counties. It's very robust. Okay, enough harping on that. So again, this is just coming back to the idea that our health systems, our hospitals are vulnerable in the face of climate change related threats. And this is an old slide coming from an organization called 427.com. Doesn't exist anymore, but it's the only thing I've seen like this that kind of puts together the health impacts with the infrastructure impacts, with the power outages and the threats to transportation, the threats to communication, the threats to water supply, inability to get rid of waste. All of these things are critical. And, frankly, we've seen a lot more of this in the last 5 years as we've had these kind of unprecedented flooding events. There's not a lot of literature on this. This one slide sums up almost all of it. But when we think about the threats to our health systems, everybody thinks about pandemics. There's so much attention to pandemics. Of course, we did have a pandemic recently, but, one pandemic. If you look at what's been shutting down hospitals over the last 20 years, it's not a recurrent series of pandemics. It's a recurrent series of floods and hurricanes and wildfires. You know, so there's back 8 years ago, 75% of hospital evacuations were climate related. There were 8 public health emergencies declared in just 2 years, 2022, 2023. So again, this is real, and it's evidence that we can use. And this is just a slide from a report that I dug up that showed that there was going to be almost of all of the regions. This was a modeling study looking at modeled risk and not actual damages or actual events, but they tried to estimate, changes in sea level rise and changes in flooding, et cetera, and looked at where all the hospitals basically in the world are located. And they concluded that North America was actually the place where the greatest number of hospitals would be at increased risk, a 5-fold increase in risk in North America, mostly from coastal inundation or from riverine flooding. Most of you have seen a slide like this, and it's a little bit dated. It's back from 2019. What's the current figure for the percentage of the U.S. greenhouse gas footprint that comes from the healthcare sector? It's not 10% anymore. 8.5%. You guys all know that. I was gonna see a show of hands on that, but no, you all know that. I don't want to go drill deeply in this. The reason I put this slide in here is because all of these little gas clouds that are sources are complex problems that have poly solutions. So yes, there is a big part of the greenhouse gas footprint of a hospital associated with the food service and the waste food and how that waste food is handled. But there's so much opportunity there for not only addressing the greenhouse gas implications of the food, but also the environmental implications of non-regenerative agriculture and also local employment. So, as we think about where we can make traction in the next 4 years, I think we're going to make traction where we're solving other problems than the climate problem. If it's just the climate problem, people are going to get scared. People are going to say, oh, don't talk to me about that. If I look like I'm smiling when you're talking to me, and it's a real world. I mean, it's a scary time. But if we say we need to be an anchor institution in our community, we need to hire people who are local. We need to ensure that people have jobs as their social safety net is being eroded. It's a different argument, and it's a harder one to argue against. So all of those things, food transport, the vehicle fleet, it's much cheaper, much less maintenance on an electronic vehicle, et cetera, et cetera. And again, this is an old slide just showing that there is this huge intersection between sustainability and resilience, especially when it comes to energy, but also efficiency, reuse, waste reduction, et cetera. I just want to go over a little bit about the policy side and where things stand. So this is an old slide again, and I used it to illustrate that, kind of just the way that other slide, that upstream downstream slide, separated public health from healthcare. The resilience world has, pretty much separated healthcare system resilience and public health resilience. And the foundational programs, those cliffs there, are 2 major funding programs. One called the Public Health Emergency Preparedness Program, FEP, that's run out of CDC for public health. One that used to be called the Hospital Preparedness Program. They're caught up in the mishigas that's going on now in HHS. Sometimes they're calling it Healthcare Readiness, HCRP, the Healthcare Readiness Program, but HPP is a part of that. And both of those fund all the states and a bunch of territories and a handful of cities directly to support resilience activities in an all hazards way. And we were focusing during our time in OCHI in opening them up to extreme weather hazards and making it much more of a part of it. And I think we succeeded. It's a little hard to know because the websites are so terrible, but both FEP and the hospital preparedness program had new guidance come out, and both of them got oriented to look at extreme weather much more. And then the other point of the slide was that there was a big gap because the hospital program was funding the major hospitals, the public health program was funding the health departments, and there was nothing for the people who had boots on the ground in the most vulnerable communities, which were the community health centers, the FQHCs, the free clinics. That's gotten a little bit better. In the revision of the hospital preparedness program, there is now an explicit call to engage community health centers and support them and make them part of the regional coalitions. So I guess the slide worked in that sense. But I just want to make sure everybody is aware of these resources that have existed. And then, of course, CMS, it has the big policy lever through its conditions of participation. And one of the conditions of participation, you have to meet all these quality standards, but one of the conditions of participation is that you have to adhere to the emergency preparedness rule. And that was a big deal. That used to say you had to have a diesel backup generator only. And we fixed that. And now you can have a diesel backup generator or a health system microgrid. The emergency preparedness rule was supposed to undergo revision, complete revision, and that was supposed to be done in the fall of 2024, and they weren't able to get it done. They hit chop water, not because of us, because it was going to have a lot more about doing vulnerability assessments for extreme weather and a lot more about doing vulnerability assessments for the communities that you're in. But it got blown out of the water by the IT and hacking and cybersecurity part of it. So cybersecurity goes in here, and they could not get everybody to agree on the cybersecurity, so it didn't get through. Big tragedy. HVP and FEP in the president's budget were demolished. The president's budget gets rid of the entire Assistant Secretary for Preparedness and Response Office, folds it into AHA, which is their kind of vapid balloon for the Administration for a Healthy America, that everything gets thrown in, but there's no details in any of it, especially on this stuff. And the FEP program was cut in the president's budget by 2/3, by half. So far, the Senate versions of the appropriations bill restore or expand them. So there's a little bit of hopeful information that the Senate recognizes the importance of these, and the House is increasingly not demolishing resilience. So anyway, a little bit of an update there. I've talked a little bit about our office. This is an old slide, as you can tell, because it's in the present tense. It says we do things. I need to change it to the past tense. But I put this slide in here mainly just to remind anybody who wasn't aware of the office, we had this threefold mission. We went to COP26 and committed the United States to this, to have programs in place to protect the health of the American people, to work on the resilience of our health systems and the sustainability of the health sector. We did a lot of things. One of the things that I'm proudest of, and which was a little bit of a stealth strategy, was we convened what our office did uniquely, which had not happened before, was to actually meaningfully engage every piece of HHS. As I said, health people run scared from climate, and people in the federal government who have to deal with appropriators, running scared is an understatement. If you approach them and said, you need to be thinking about climate change, it's like, I have enough trouble, just with my health appropriators, don't put climate change in with it. So there was not a lot of activity, and there was a lot of fear, a little bit of loathing. And it was a big uphill battle for us, and something that that I saw as the most important thing we could do in some ways, because I knew our office was short-lived. I knew our office would only survive in a Democratic administration, and that the best thing we could do would be to change minds and hearts in the other parts of HHS that would survive us. Now, I way was off with how much of HHS would survive us, and that's been a problem. But looking at what was done, what was planned to be done, I think is part of the blueprint for what can be done. And a lot of these things were, it's all framed as the federal government doing it. Many of them are transportable to the state level. And so all of the incredible work VCCA does to take the California car rule, to do the, to talk to the legislators, this is the kind of thing that we can and have to do now. And so, I don't know how to go backwards anymore. There we go, hours work. So in this document were the things that had been done as of 2023 and the things that all the agencies were saying they would do 2023, 2024, most of them got done. But the other really important part of this is we put in an aspirational section. So we put in a frame for federal policy and what are the buckets that need to be filled. Everybody thinks, well, okay, we need to fund health departments. And, that's all there was for 15 years, the BRACE program. That's all we had in the federal government. We had no workforce training. We had no link to human services. It was just giving health departments a little smidge of money so that they could hire and do an evaluation of one problem. So this laid out what we thought was a fairly comprehensive approach. And that's what we're going to spend a little more time doing. So these were the kind of examples that were somewhat aspirational, although some of them were much more close to actual implementation than others for the different divisions that we thought would survive us. NIH looks like it's going to survive us. I think the support in Senate is very good for NIH. They're increasing the budget and not killing it the way the president's plan had it. And don't tell anybody, but the funding streams that they established under what they were calling a climate change and health initiative, which does not exist anymore, are kind of intact. And the centers that they had created, including these ACE, probably EW, it's not CH, it's extreme weather, they have been able to justify, perhaps because people are suffering from extreme weather in this country, and it's kind of obvious we need them, but one of the good success stories. The CDC revision of FEP, that actually happened. They didn't commit to it, but it actually happened. CMS, I told you what happened to that. AHRQ published their guidance on life cycle analysis. AHRQ, of course, is in an exquisitely vulnerable state right now, may not survive. That's the Agency for Healthcare Research and Quality, for those of you who don't know. It is the only place where health services research exists, and for reasons that you couldn't get me to explain this even under hallucinogenic substances, why a federal government would think that health services research to improve the quality of healthcare is anathema. I don't understand it, but they want nothing. They want their eraser on that, and that may happen. And then the Indian Health Service, I think, has a plan to create this net zero medical facility. I can't remember where the Tohono O'odham Nation is, somewhere in the Northern Plains. And then FDA, we've been kind of dreaming about them doing something about HFA propellants. We'll talk about that. These are the 8 pillars. So it's a little bit hierarchical. There's a foundation of collecting the right data, which we haven't done. Like we have no, if you look at billion-dollar disasters, their data source is primarily looking at news stories. Isn't that insane?
Just actually wrote policy on this.
Oh.
Couldn't find any research on like disaster preparedness or specifically like what was going on. And I referenced all of the news articles.
I tried for years working with ASPR, and with FEMA, you know, to do even like a large learning model analysis of the report. All they do, they get reports, they get before and after reports, but they don't look at them. Unbelievable. So anyway, if you want, if you want to give good quality care, you got to do some research, collect some data on what good quality care is. If you want to have resilient health systems, well, you ought to figure out what makes them not resilient, what makes them go down. And that hasn't existed. And then measures is like, ooh, that could be a 3-hour talk, because that's really embedding these things into quality, because quality is the lingua franca. It's the currency of the realm, right? That's what's going to persist. We're going to have to, you know, get this to be part of quality for CMS and ultimately part of certification for JCO to embed it everywhere. Next level is the workforce. So that's training, but also right now, moral and emotional and mental health support, because we're in a crisis with that in healthcare. Enhanced program and practice, all the things that you guys talk about and learn about, you know, getting at waste streams, using reusable surgical instruments, that kind of thing. Technical assistance is a huge part of what the federal government has done. And we actually succeeded in getting extreme weather and resilience technical assistance written in to the scopes of work of contracts, which we used to think were really hard to undo. Like federal contract used to be something that like, oh gosh, that's there for 5 years. I think those contracts are still surviving. This is the NTAP, the National Tech, I forget what NTAP stands for. T and Technical Assistance Program. That's HRSA for the community health centers. And also there's 2 technical assistance programs, and my brain isn't good enough to, in CMS, one for all hospitals and one for Native American hospitals. And then up at the top, policy and regulation and adequate funding. Okay, enough talking. I'm going to do a little bit of an exercise. So that's a box for those of you who don't recognize technical stuff. And maybe some of you have seen this. I got, you know, I talked about, you know, the inch thick callus, right? You know, it's very easy in the federal government to kind of throw up your hands all the time and just say, Congress, they're not giving us any money. You know, that agency over there, they won't talk to us. They're not answering my phone calls. I can't do anything. And, you know, especially where I was working, which was the Assistant Secretary for Health, which isn't funded for anything really, except in very nefarious ways, and yet has like mission, like let's get all of HHS to work together on reproductive rights. Not too hard, not too controversial. So anyway, I was influenced by somebody who came in and said, well, we have a way to do this called thinking inside the box. And I don't know, anybody heard of thinking inside the box? You know, the cliche is outside the box. Oh, you know, let's brainstorm, let's get really creative. Let's think outside the box about what we can do. But the reality is sometimes you're boxed in, right? The reality is sometimes you have a lot of constraints and you can spend a lot of time blaming other people for why you can't do anything. And this is kind of one of those times, right? Like we're all kind of inside a box. So I want to just go through this a little bit. I think I still have a little bit of time, and I'm talking too long. We'll go through it quickly so that you guys can ask questions. But just think about this, because this is, you know, something that I think would be interesting for you all to do. So thinking inside the box. So you start off and you say, well, what is it that we're really trying to achieve? And I'm going to keep this broad. I just put in our 3 missions from OCHI, you know, the whole shebang. Protect people, protect health systems, make them more sustainable. And I'm going to fill the box with these 4, well, actually it's 6 pillars or domains of strategy. I changed policy and regulation for us to advocacy for policy and regulation, right? You know, unless you're also a state legislator, you're not doing it, but advocacy, and then data research measures, program, practice, workforce. And I'm going to start us off with a few things that we talk about as why we can't do anything. One is, and this is now, like this is right now, talk to CEOs in hospitals and everything. Oh, I'm in a poly crisis. Don't talk to me about climate change. Climate change is 2050. You're talking 2100. Don't talk to me. I'm paying $150 an hour for contract nurses, and I still can't get enough. All of my doctors are out on sick leave, like you guys know the poly crisis, my funding's getting cut. We're running negative revenue. Don't talk to me. We're in a poly crisis. And then, the other one is you talk to clinicians. It's like, I have 13 seconds to deliver everything about, smoking cessation to my 18-year-olds. Don't talk to me about putting something else into that. Now we also have, kind of complete lack of federal framework, supervision, guidance. It's not a small thing to be able to say the federal government thinks it's important. They have an office. Oh, it's federal government thinks it's important. They've just written it into their hospital protection program. So just that kind of federal government cares about this is big. And then there's all the cuts of people and money. So what else is outside the box? What else is constraining us? I know that's a pretty good list, but what else? There's other things.
Honestly, one of those bigger constraints is what I would call a perverse system of health outcome driving at the federal level, whether it's CMS or otherwise. And it actually gets to the reason and the rationale for your delta between downstream, midstream, and upstream. That work
The perverse incentives or
the perverse way in which we measure healthcare outcomes. We remain procedurally based and those kinds of things. And until we actually flip that a bit, and it has to be flipped locally to be clear, first, you're going to have a mismatch between.
Disregard that, board members.
You're creating a greater mismatch than there need be.
Yeah. So the whole US paradigm really screws us. Because, the way you save money, the way you make money is completely perverse. So that's really important. Thanks. Anything else? Any of the students? Especially thinking as students, like, you got a career to think about. That's a constraint outside the box, right?
I mean, lack of time very much applies to us, and we're here, but we also have a million things to do in our education. I think for me, just seeing an extremely polarized viewpoints in our patient population, and also just like difficulties with lack of education in our patient populations and how to reach them as people who are highly educated, how to get down to, or not down to, but like to a different level of education and reaching them. I don't know, just general thoughts.
I'll add disinformation into that. Yeah. Thanks. All right, that's all I have room for. There's probably more. That's probably more. Let's just take a second and, okay. There's a lot of doom and gloom there because we're at hopefully peaking in doom and gloom right now. I mean, it's hard to avoid it. I don't want to avoid it. I want to hold it. But my point in being here is that doesn't stop us, right? That doesn't prevent us from doing things. And so what are ideas that, you as medical students, you as residents, you as future doctors, some of you who are done being medical students are doctors in health systems. And these could be things you're already doing. Think about them, in the different boxes. You're talking too much. No, go on.
Let's jump in. So I'm really involved with our Medical Society of Virginia, which is like a policymaking group and a lobbyist organization in Virginia. And we have developed a very robust medical student section where any medical student can write. Oh, I'm so sorry.
I'll just repeat that briefly. I'm very involved in the Medical Society of Virginia, which is a lobbying organization by physicians in Virginia. And we have a very robust medical student section that has the opportunity to write policy. So I actually just wrote policy not related to climate health. And several other of my peers that if passed, we can help the Medical Society of Virginia write related bills to propose to state legislature to get laws passed. Like there's so much opportunity here. So, and physicians as well, there is opportunity for involvement with the Medical Society of Virginia. So you can write policy at the clinician level.
That's great. That's a great example. And, there's medical societies, there's, of course, there's the Medical Society Consortium, which is the specialty medical societies where you can get involved. There's things like the Primary Care Association, if you're a primary care person, that are incredibly important. So thinking about state level advocacy, absolutely.
I think about underutilized sections of the healthcare workforce, and one that comes to mind are community health workers. So community health workers, whether that comes in the form of adding a lecture within a community health worker training program that touches on these things as they relate to kind of that gap you mentioned in terms of safety nets and resiliency. CHWs are a great aspect of the healthcare workforce and a great team that will help kind of bridge the gap between hospital and community. So whether that's training CHWs on climate and health, because I'm involved with the training program for CHWs out of Howard County Medical Center, and we have a health disparities lecture in the curriculum, but there isn't an environment lecture specifically. So trying to build that relevance for this group that actually works with patients on a day in, day out basis outside of the hospital or outside of clinics, kind of getting into a little bit more of that non-traditional. I don't know if that's inside the box, but it addresses that lack of time to a certain extent.
Feels inside the box to me. And that's a really great example. And it's happening in a lot of different places. I've talked to folks, there's great models in Florida where they've really trained up the community health workers. And, again, training underutilized healthcare workers is huge payoff because, again, knowing we were not going to exist, my goal was not just to try to plant little seeds of policies, but to change as many minds as possible in the people who would still be in the institution when I was gone. And we actually, one of the last things we were able to do was to we created a training module, put it into the agency's learning management system, and we made it mandatory. We had it already mandatory for the senior executives. We made it mandatory for every manager. I'm sure they all took it in those 2 weeks before our office was shut down. But every mind that you change there, like that, Abigail, you talked about the ripple effect. That is the ripple effect. So that's a great one. One more thing inside the box, and then we'll close up and go to other questions if we have time. Yes.
I think I am seeing a lot of inside the box things
Through the consortium has a climate smart healthcare working group made up of state leaders from across the country. And there's just so much work that has been happening within, the limited parameters that folks have had for decades. And we're seeing, I think, some real success, and a couple states have really built out green team programs at their healthcare institutions, hospitals across their state. And like just doing kind of like a relentless education work in those institutions. And yeah, so like I feel like there's a lot of stuff going on, and just like piloting small programs at different institutions, doing research, just kind of like continuing forth in scrappy ways. That
maybe even fits in 2 boxes, right? And so you are the Medical Society Consortium, right? So you are an NGO. If you're a clinician or a med student, they can go through you. How else might they do that?
Yeah, and I know Roman gave a nice plug before, but if you are, we
mostly have representatives on this call specifically through the state group. So if you were to get more involved with VCCA and wanted to come represent VCCA on healthcare sustainability work, but there's also just so many opportunities to plug in otherwise. And I know the QR code was up on the screen before. And if you're interested in getting more involved at the national level, definitely I'll be here during lunch.
Awesome. All right. Worthwhile way to think. Take it home. Share it with your friends. Parties on Saturday nights. We'll have a think inside the box party. There are many, many other things that can go inside the box that we can do now that make these differences. So that is the most important thing. that I wanted to leave you with. How do I get to the bottom of this, so to speak? Where am I? Where's the slideshow thing? Is there a top right? What? Where'd it go? Oh, you mean where it says slideshow? Yeah, I'll click through, sorry. Oh, I meant to go through to this slide. There we go. I've said all this. You can read it. It's a nice picture. I love this picture. This is from the space station as it flew over the Rockies. That little thin green line is what we're trying to heal, right? So it's just a beautiful image. Thank you for your attention. I hope that was interesting. And do we have time for a little more discussion?
Yeah.
Or folks want to, oh, lunch isn't there, so.
That means you got time.
It's outside.
It is outside, okay.
Yeah, but we have time, we got, medical students, practicing physicians, nursing professors, healthcare, public health professionals. So yes, feel free to ask a few questions and then we can all break for lunch and do the networking.
So a lot of the rural hospitals are closing down or anticipated to close down after the Medicare and Medicaid cuts. And some of those are going to be in areas where there's going to be they're more inclined for billion-dollar disasters. Was that part of your thinking? And then kind of what are some approaches that other hospital systems now are going to have more demand in those areas? What are things that communities themselves can do?
Yeah, and that is totally a wicked problem and I don't have a solution. I mean, it's emblematic of what's happening now, isn't it? I mean, when you lose a rural hospital, the impacts are devastating and it's really hard to just build it back. Like it goes down for a year, it doesn't come back. I don't have a solution other than I feel like philanthropies need to step in and just keep the damn things alive because there will be, there will be deaths associated just with the loss of that hospital. And then God forbid, you get a $1 million disaster at the closest hospital for a huge area. Where are those patients going to go? So, that is a huge issue. And again, it just, I can't wrap my head around an administration that's kind of declared war on urban areas, declaring war on rural areas as well in this way. Which areas do they like? I don't know. Small parcels on the coast of Florida.
A question about data, because I think that's as practicing healthcare providers, we rely on data to inform us about where the evidence is and what policies we should enact. And there's also more data these days, as some of the reports are being taken down, erased, or even an attempt to revise it. Your thoughts about that, and from your awareness, any efforts in terms of preserving these data going forward?
Yeah, I mean, that's one place where I think there is a lot more reason for hope. There are tons of efforts underway, being led by academics and being led by ex-feds to preserve, recreate, and try to provide the services of those data in the absence of a federal government that cares about having evidence like that. For example, all the people or the person who ran climate.gov, the kind of comprehensive NOAA website with climate data on it, has banded together with colleagues and they've created climate.us, trying to create all of that, to preserve all of that. In terms of reports, there are a bunch of organizations that have done that. I've done that. I have captured all of our PDFs, everything that's a report. Unfortunately, we created websites that can't be quite as easily converted. But I've saved the strategy supplement. I've saved all of those documents that the health chapter of NCA 5. It's all on. I've got it on my website. Others have it on institutions like, the Cafe Center, the NIH-funded P20 Center at BU and Harvard has captured a lot and maintains that. The thing that I hope to figure out, get my head around is, federal data all comes from the states anyway, and state data all comes from the counties, right? We have a completely decentralized, federalized health system, which relied on federal money and federal guidance and federal collection to make sense on a national scale of state level data. But they didn't collect it. It was, the federal government can't, well, it can. It's got to cut the money, but, there's other sources of money for the states and localities to do that. What I haven't seen yet, and I may not be in the right circles, but I'm trying to break into them, is anybody trying to fulfill the function of the CDC and aggregate those state data. I am seeing regionalization of the states, and I think that what we're likely to see is the development of coalitions and regions that take on some of these federal functions. We've already seen Washington, Oregon, and California take on the function of vaccine regulation. And I wouldn't be surprised that they aggregate their state data. We'll have the Northeast, we'll have Great Lakes, and then, the places that are public health deficient perennially, like the Southeast and, some of the plain states probably just won't have it. Good thing to do, though, The other thing that's happening, and yeah. That data flow, the data that comes from public health surveillance and has been the CDC's source of data, has lots of challenges to it, right? And there are private entities that sit on incredible data, massive reams of data, Blue Cross Blue Shield being one of them, Kaiser Permanente being one of them, the private outcomes data. And there's a lot of, there's an effort now underway. I'm working with the Healthcare Without Harm to bring together the insurers and to get them to start to use their massive data, at least for themselves, to start to estimate their climate-related risks. So there's a possibility there too. But I'd say it would be very optimistic to think that the private sector entities, the health insurers, or the major hospital corporations will actually band together and work cooperatively and collectively. That's not kind of the way they do stuff. Any other questions?
Let's throw this out here. So hi, I'm actually in a school of nursing. And so many of the things that you discussed, we absolutely address.
Yeah.
Because we are very patient-centered, we are very people-centered.
And human services, yeah, exactly.
Yes, and there has to be an integration, right? It can't always be somebody else's job. And so I really appreciate you talking about the upstream, downstream approach and targeting midstream. I think that sometimes we think about directionality and this top-down sort of thing. And while, yes, it's true that if the system is broken, people suffer, and we have to build strong systems. There is also this other approach, and I think this speaks to your working within the box, is that what we still have is we have a lot of humans, so we have a lot of people. And so I wonder what you have thought of or what your experience is with community engagement and community organization, and how that really is a source of data, but also really can inform us as people who care for people.
That's an awesome question. And I'll just say first, personally, I sometimes feel a little bit like a charlatan or a dilettante, because in my career, I have been challenged and haven't broken through the challenge of direct place-based on the ground work myself. But I believe that the primary solution, and office was created, it had one mandate in Executive Order 14008, and that was to protect the health of the most vulnerable. And I said, I'm on it. Like, yeah, let's do this. And then Congress turned around and they passed the Inflation Reduction Act, which gave, $7 billion to EPA to work directly with communities to create resilience. And they gave $0 to any part of HHS to do anything related to climate change. So I said, okay, Congress checked the box. I'll work with EPA as much as I can. I supported them with one of my best people for 6 months. She went in and worked with that program. But I think that if we're going to save lives, that's the ground that we have to be walking on. And there is a big movement right now in the climate adaptation space. First of all, climate adaptation space is a big movement right now. There were for years in this climate policy movement, they're like, don't talk adaptation. We can't give money to adaptation or we won't mitigate, which was really a very misbegotten, I always thought, stance. And it was one of the things that, well, anyway, I won't go down that road. But that's changing, and there's a lot of efforts underway, and everybody, to my delight, is honing in on the concept of community resilience hubs. And for those of you not familiar with the concept, they are community-driven, organic, community-owned, community-maintained spaces, not usually government buildings, but community-maintained spaces that integrate and braid resources and provide 365-day-a-year services to a community, but are fortified, resilient, and provide emergency response capabilities too. I have been, because all of the money went to EPA and not a penny went to HHS, because all the money goes to hospitals and not a penny for resilience goes to community health centers, the health sector's been systematically excluded from that movement, except where local people are kind of a little more enlightened, like Austin, where there's a whole network of community health centers that are resilience hubs, or New Orleans, where there's a whole, the community health centers are part of a, resilience hub movement. So I think you're spot on, and my take on that is one of the most important services to put into that, in addition to all the human services, is health services, is preventive health services. And so this is one of my big beefs with philanthropy. I mean, they're spending, countless billions of dollars for some magic bullet technological solution, and they will not put, $1 billion into community resilience hubs would save thousands of lives the next year. So thank you for raising that. I have a bit of an opinion on it. I wrote a paper on it in the Surgeon General Public Health Report about how to do health integrated resilience hubs. And I am, in my work now, trying to figure out a way I can actually work with the community to try to do that. So thank you.
Thank you so much.
All right. Thank you, everybody, for your attention.
And I'm gonna pass it on to take care of that, to close up our programming.
John, thank you for all the work you've done, and thank you for having the foresight to anticipate disasters. One, I know you're all hungry. I won't be long, but we'll use this was going to be our networking hour, so we'll do that over meals. But I wanted to do some thank you. Bev and Ryan just walked out, probably for lunch, but I really wanted to thank Bev for the consortium and all the help they've done to help us put this together. Ryan, if you've not met him, he's responsible for hosting this as well, and he's done a great job. I also wanted to thank everyone who's attended here, both here and virtually, and particularly the speakers, because I think it's been a great day, great panel, very interesting. And this is one of the most successful events we've had as an education committee. So thank you for all who participated. For those of you who, we've had some board members come in, and I just wanted to take opportunity to introduce them. Bob, who's our advocacy chair, and it's come up. Well, you can clap. I'll let you clap. But I wanted to say our advocacy day is January 29th, I think. And some of you, even though you're not in school in Virginia, still have Virginia residency and Virginia experience. And you're welcome to, we'll give you more information on that as time goes on, but you're welcome to participate in that. And that's an in-person state advocacy day. Mo is our financial guru, and thank you for, helping supply the money and ability to do this. You've all met Abigail. If I'm missing anybody, let me know. But again, thank you. Please use this as an opportunity to talk about questions. Oh, one last thing. And I know numbers of you both are at UVA and have done extraordinary work in your own institutions of creating this. But I think I wanted to call to mind a former member of our group, Lena Bichelle. Some of you may know her. She's now a pediatric resident at UVA, but she is responsible for the class I taught at Shenandoah, and I think sort of the basis for the elective taught at UVA. During a fellowship time she had as a meta student, she created a course template that we've all used. And so you as med students can empower us older clinicians or other people to change your institutions in a, sounds like, permanent way. So I just wanted to shout out her name, and thank you all for being here. Go eat. I'm not going to assign tables. Whoever's fastest can get there first.
Fill out the survey.
Okay, yes, fill out the survey and we'll talk about that. Thank you. So,
Well, lunch is served. We'll try to find a time to take some picture, but go ahead and grab some lunch and then we'll finish up.
Take some with you, there's actually probably will be.
And so far, I've worked out. I'm and I took a few months to go a little quiet and.
Yeah, it's been out there so much.
Sorry?
Not too much of a target myself. And I'm
realize that.
starting to.
It's okay for a while.
come back.
You make a time.
Yeah, I haven't been anything that DEI watch.
Thank you. Yes. Should we, where are we?
Crazy.
With our space?
Yeah, where they're.
Still like 10 people.